Good morning. Welcome to Wednesday in Education Policy and Administration. We have 3 bills this morning, and we will take a break next week. It looks like no committee or House session. So we'll try and make up for that in the future. Anytime. Maybe we.
Is that 100%? No session?
No session next week.
100%?
Yes.
Okay, thank you.
Yeah. The following week, the 17th, is in question.
No, next week is 17.
Oh,
No,
right. Yeah. There possibly might be one the 24th. Right. Maybe we can get started with the Pledge of Allegiance. Representative Noble, would you like to lead us?
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And our first bill of the morning is Senate Bill 34, relative to parental consent for student participation in Medicaid to Schools program. And Senator Ward, the prime sponsor, is here with us. Welcome to the House Education side.
I've been in this room before. So.
Yes.
Good
Quite a few
morning, Mr.
times.
Chair and the members of the committee. I'm Ruth Ward, Senate District 8, and I'm here to introduce Senate Bill 34 for your consideration. This bill was a recommendation from the committee to study consent and confidentiality laws applicable to adolescent and young adult health care in New Hampshire. It would require schools to obtain parental consent for each new service that is provided to a student under the Medicaid to Schools program. Also, it would require certain legislative policy committees to receive reports regarding the Medicaid to Schools program. The intent is to provide transparency, protect parental involvement, and ensure that continuity of care is provided to adolescents and young adults. This is more important than ever, especially since the Federal Register proposed the removal of parental consent altogether for services in 2023. This poses concerns for adolescents and young adults, especially for those in the disability community who rely on parental involvement in their services. I know there are advocates here who can answer better answer questions that you might have on Medicaid to School services. I should mention to you that at the Senate hearing, I had suggested that the Primary Care Association and the HHS come up with something that was a question about one of the wording of the bill. I received it 2 days ago, too late for me to do anything about it, so I am giving it to the House for your consideration. I believe that each one of you has got a copy of the proposed amendment. So with that, not taking any questions, those better behind me who can answer questions. Thank you very much.
Thank you. Any questions for the senator? Representative Balboni?
Thank you, Mr. Chair, and thank you for taking my question. So the amendment that we have in front of us is the suggested language from the committee or from the?
From the Coalition of the Primary Care and the HHS.
Okay.
I believe it says that on the top.
A follow-up, please.
Yes.
So it changes instead of new service, it's a new care plan. So I'm assuming care plan is a language that's currently used somewhere, and maybe somebody's nodding behind you, so maybe I can get follow-up on that later.
In the bill, it's mentioned service, and they would prefer care plan. That's one of the changes.
Yeah, I think there are people who will be able to answer that specifically. Yes. Yeah, Representative Murray?
Thank you, Mr. Chair, and thank you for taking my question. I think, and it's probably not a question for you, but if it is, I guess I was curious because not all IEPs have individualized healthcare plans associated with them. Sometimes they do as a component to their IEP, and sometimes they don't. So, is it only in the case that an IHP has been written?
That is a question that I think people behind me can better answer.
Okay, thank you.
Thank you.
Representative Paul?
Thank you, Mr. Chair. Thank you for taking my question. So do you personally support the amendment?
Pardon?
Do you support the amendment? I know
I
you've
do,
seen it
but I
for
mean,
2
I can't
days,
do
but-
anything about it because it just came 2 days ago, so there was no time for me to put it into the bill.
But if,
Yes,
follow-up?
I do support it.
Okay, thank you.
Any further questions? Thank you very much, Senator,
Thank
for
you.
presenting this. Next, we have Ms. Burtis and Ms. Stoddard. I believe you wanted to come up together.
Good morning. My name is Christine Stoddard, and I represent Bi-State Primary Care Association. We represent New Hampshire's 10 community health centers throughout the state. And I have with me Betsy Burtis from Amoskeag, who can introduce herself.
Hi, everybody. Thanks for taking our commentary. I'm Betsy Burtis. I live in Derry. I work in Manchester at Amoskeag Health. I'm the Chief Operating Officer. And we are trying to come up with a better way to work this bill so that it works for everybody and isn't so burdensome. The issue with using the diagnosis changes is that the structure of the diagnoses are very finite. So you could have one shift under the main header of a diagnosis, and then that would require a change in consent as the bill is written. So it would be burdensome to our parents, it would be burdensome to the staff, it would delay care to students. I think it would also be burdensome for state Medicaid to monitor to see if that was happening, and to do checks and balances on that. And so we are speaking in opposition to the bill, but in opposition as written, and we would support it with the amendment.
And I take full responsibility for not getting the amendment to Senator Ward in a timely fashion. But one of the issues that was raised also is that a code could change from the time that you start the appointment to the end of the appointment. And so the healthcare providers would be in violation of statute just because a patient might have said something like, I now have anxiety. So the child could have come in with a depressive diagnosis, and then during that appointment, they talk about also having anxiety. Our health centers would be in violation of statute because they didn't get consent from the parents for anxiety. They got consent for depression. And so this amendment would just clarify that it's the case plan that requires consent. And it's my understanding that this is consistent with current statute, which also already requires consent.
Thank you. Questions from the committee? Representative Balboni.
Thank you, Mr. Chair, and thank you for taking my question. So my question is, if this is consistent with current law, what is actually changing?
Representative, I think that I don't want to speak on behalf of the sponsor, but I think she's trying to clarify when written consent is required. It is already required of statute. And it's also actually written into House Bill 2 that the House is voting on tomorrow.
Representative Woodcock.
Thank you, Mr. Chairman. Good morning. Welcome. Thank you for
Morning.
coming. I'd like to go back and start. I'd like to go back to your example a minute ago, if I may, so to make sure I'm clear. So you spoke collectively as in opposition of the amendment of the bill.
Yes, as currently written, but we would be okay if the amendment was adopted.
Okay, so may I, Mr. Chair? Your concern about the change in diagnosis during the meeting with a provider is satisfied with the amendment. Is that what you're saying?
Yes.
Okay, thank you. Thank you, Mr. Chair.
Yes, Representative Selly.
Thank you very much, and thank you for taking my question. I'm someone who does bets with a case study sort of analogy. So, if there's a child who is getting special physical education services for a physical delay, developmental delay or disability, and during that session with a specialized physical education teacher that would be covered under this, if they realize the child needs some additional, like they need trampoline time as well, the way the bill is currently written, would that require the parent to sign, even though it's essentially using a different modality? I'm trying to understand how the original bill would work or benefit someone or not, and I just can't make sense of it. So I'm hoping to get further clarity.
Do you want to answer that?
Yeah, I think probably Senator Ward would best speak to that. But I think the short answer is yes. Is that anytime, if you added on a service within a care plan, so you first meet with the kiddo and you do, an assessment, and you have in your head one way that it's going to go, you get consent at that time. Actually, you'd get consent even before that diagnosis process. So what you think you are working with when you meet with the child could end up being different than what you're working with. And so as written, it would require, even in the subtlest change of diagnosis code. So as Christine said, adding on anxiety in addition to the depression would mean, okay, we got to stop the session and we need to stop and get parental consent, rather than having it building up a care plan that is sort of the course of treatment. And I guess would compare it to in a doctor's office that you are, your diagnosis is cancer, but then there are different treatment modalities that also change that diagnosis subtly. You're still treating the cancer, but would you have to redo consent every single time?
Thank you.
Representative Murray.
Thank you, Mr. Chair, and thank you for taking my question. In the event that I was talking about the individualized healthcare plans are not always included in an IEP, so this would only exist in the event that an IHP was drafted and attached to an IEP. Is that correct?
This only applies to Medicaid services.
Correct.
Yes.
But there would have to be a health plan associated with either the 504 or the IEP.
Yes,
Okay.
that is my understanding.
Follow up, if I may.
Yes.
And how long, is it dependent on the parent then just signing off that would be the time constraint until the child would then receive services? Or is there a lag time, if you will, between the change in perhaps service and diagnoses to when that could be implemented? I heard you use the words that you would stop the treatment at that point.
Yeah, so the way the process works now is parental consent is required for a child to even be seen by any specialist in the schools. And so they would say, yes, I want you to work with my child. You go in with maybe certain assumptions. The parent is asking for services because of certain symptoms. And then once you meet with the child, you discover that something else is going on. And yes, the parent needs to be involved in that process, but it would not necessarily require you to stop. And stop services and then try to find the parent, which has been really burdensome because a lot of parents are working. They can't take a phone call. They may not have a printer with them to be able to print out the consent form. So it's logistically and practically just really challenging.
I was wondering, the health care plan is a separate document that the service provider would develop outside of the IEP or 504, because those are not required for this as long as they're a Medicaid eligible
Correct.
student. Is that correct?
So yes, it's not just for those IEP related services, but any medical services that are, or mental health services that are happening in the schools.
Right. And maybe someone else could answer this question, but would the service provider, who would the service provider be in a school?
For our staff, it's our staff, our employees that go into the schools and work and are based out of the schools. So it could be an Amoskeag Health employee, it could be a contracted speech language pathologist that is contracted, they're doing a private practice. It could be, a medical provider that's going in and seeing acute kinds of cases. So and they also could be employees of the school.
I should add, Representative Cordelli, that community health centers exist in what are called medically underserved areas. That's a federal designation. So it means that there's a lack of healthcare access in those areas that the health centers serve. So if you look at the North Country, Ammonoosuc Community Health Services also has Medicaid to Schools. They participate in the Medicaid to Schools program because there is a severe lack of behavioral health services in the North Country. Coos County Family Health Services, they are the only primary care provider in the Burlingame-Gorham and Colebrook area that takes Medicaid. So it would be very hard for people and kids in the North Country to access school-based services if this bill would pass as written.
Right. If I could follow up, so the service might be performed within the school, in the school building, or at one of the provider's offices.
Yeah, it wouldn't be covered under the Medicaid to Schools if it was in a provider's office.
Okay.
Only if it's
In the school, okay. Who would be doing the billing for that service if it's performed in the school? I've heard that the school might do it, or they might contract with a billing service. Do you have any idea about that?
Yes, it could actually be one of many different ways. So depending on where that person is employed, if they are in private practice, they may be doing their own billing. If it is one of our employees of the health center that's in the schools, we would be doing the billing.
Gotcha.
And if it's an employee of the school district, they would probably be doing the billing or outsource it to another company.
Thank you. Reverend Marie?
Thank you, Mr. Chair, and thanks for taking my question. So it is true that each individual case file would have to be updated by the provider, notes being made, and then a recommendation that requires either an adjustment in the care or the treatment plan, and then a sign-off, correct?
Right.
Okay. And one more follow-up, if I may.
Yes.
And so with regard to the billing you were mentioning, so like, for example, with mental health care providers, oftentimes that billing gets sent, if you work for a service, for example, and the provider's in the school, that gets sent somewhere else, and the billing then gets submitted afterwards, correct?
Right.
Okay.
Representative Baboni?
Thank you, Mr. Chair, and thank you for taking my question. Just one more for clarification. This amendment right here, you said that the original bill is included in HB2, or is it with this amendment?
I believe the language in HB2, I'm paraphrasing, it says something to the effect of if consent is not given, then Medicaid to Schools services for that child have to cease, have to stop.
So again, so it's not this language.
No, it's more to consent of the entire service program for that child. That's my understanding, but DHHS is here. They might be able to clarify.
Representative Woodcock.
The clarification for you, actually, versus them. So following up on that dialogue, if HB2 is passed, the statement is contrary to this, then, and this is passed in the House, how does that happen? What happens?
First of all, I think that there would be a committee of conference for this bill because it's being changed in the House from the Senate version. I think the Senate then would, while they're working on the budget, see how the language in HB2 is actually written to see if any change is required based on this Senate bill. I haven't looked specifically, but we can check. We don't have to vote on this today, so we can check on today on what's in House Bill 2.
Thank you, Chair.
Yes, Representative Murray.
Thank you, Mr. Chair, and thanks for taking my question. So if I'm understanding correctly, with this new proposed amendment in the language that you all have drafted, only the portion that has changed would result in a delay in service, whereas the original language would stop everything? Or would the same effect?
The original language, Representative Murray, would require that our health centers stop services mid-appointment to obtain consent from a parent. And I have a child on an IEP. I work full-time. I don't have Medicaid, but I can tell you just filling out those IEP forms is a large amount of work. So I can't imagine having to interrupt a parent midday, track me down because I'm usually at the State House to sign a form while my child's at school. It's very disruptive, especially if you have a kid with autism who expects a certain service at a certain time.
And as a follow-up, if I may. So with regard to the new amendment, the interruption would be to which part of the service, I guess is what I'm wondering.
Sure, we don't believe there would be an interruption.
Okay, thank you.
Yes, thank you.
And if I could follow up to her follow-up, if during the consultation it's discovered that maybe anxiety is an issue in relation to the original purpose for the consultation, does the care plan get updated, and when would that occur?
The care plan would probably be developed after the first visit. So, here's what we saw in that visit, and here's what we're recommending. We strongly encourage parental involvement all along that process. I think it's just the requirement that is so burdensome. So the care plan would be developed. If there were still questions at the end of that first meeting, the care plan might not be developed until the second or third session, until it was completely clear on what we were working with.
Would the updated care plan then be reviewed with the parents, or how would the parents become aware of this additional service that's felt is needed for the child?
With the amendment as written, yes, that would happen. So if the care plan was developed, and then it was seen that something else, some other sort of service or treatment was required, then it would be communicated to the parent and get consent again.
Yes, Representative Cornell.
Thank you, Mr. Chair. Thank you for taking my question. So the only thing that the amendment would do would mean you wouldn't have to stop in the middle and get permission. You could carry on and then get permission after that. Thank you.
Any further questions? Yes, Representative Hall.
Thank you. Thank you for taking my question. I might have missed something. So I think you're agreeing that the amendment needs to fix this. So my question is, do you support it as amended, the bill, or do you think it's not really necessary, or, yeah, how do you feel about the bill if it were amended like this?
Consent is already required in statute. I think that Senator Ward would have to say why she's going this next step, but legally, it's already required.
Okay, thank you.
Representative Murray?
Thank you, Mr. Chair. Thanks for taking my question. One other thought occurred to me. What if a child is homebound for some medical service or an illness where the school is still required to provide some services for a short time outside of the school building? Would this amendment allow for that to happen in the home?
I believe so.
I believe so too.
Okay, thank you.
And Amoskeag actually operates one of the only special schools program. What is special medical program? Because there are only 4 developmental pediatricians in the entire state of New Hampshire, and 2 of them work for Amoskeag. So it allows kiddos like Representative Murray just asked about to use telehealth services no matter where they are. So Amoskeag can provide special medical treatment to medically complex children across the state using telehealth. So it should be okay.
Great, thank you.
Yes, Representative Woodcock.
Just clarification, I thought, I'd written down, I must have confused something. I thought you said prior that the service must be conducted in the school.
Representative, I think I can get clarification, or we can ask DHHS, but I think it would apply, but DHHS might have a better answer.
Okay, thank you.
Maybe I made a mistake.
Any further questions? Seeing none, thank you very much. Appreciate your being here and bringing the amendment forward with Senator Ward. I think there is a gentleman from Department of Health and Human Services here who might be able to shed some light on some of the questions.
Good morning. Thank you, Mr. Chairman. For the record, my name is David Chorney, and I'm the state's Deputy Medicaid Director. So I'm happy to answer any of the questions that have been raised around the Medicaid to Schools program. And I think just sort of from an operational standpoint of Medicaid, when you look at, so there are over 70,000 ICD-10 codes, and within, a care plan that could be built off of a diagnosis of depression, there are multiple different ICD-10 codes that could then be billed. And so basing it off of the care plan is more operationally feasible than, the provider who could choose to bill this ICD-10 code for this service versus this ICD-10 code for this service. And if the parent had only consented to this ICD-10 code, then it becomes an issue if they want to bill this ICD-10 code, even though that the care plan that's been consented to would encompass both. And so that's why I think the amendment that has been proposed is more operationally feasible to ensure that the parents consent to the care plan and the services that are provided within that care plan, and any changes to that care plan to incorporate a new service is more operationally feasible for the department than basing it off of a change in ICD-10 codes, which not only are there over 70,000, but they change from time to time. They add new ones. They take some away. And sometimes we tell providers not to bill certain ones because one ICD-10 code may be based on a service that should be provided in a group setting rather than individual. And so there are program integrity aspects of it that also feed into which code should be billed and shouldn't be billed.
Representative Murray. Oh, yeah. Go ahead. You're right. Did you have a follow-up?
A question, initial.
Okay.
As the law stands right now, does this bill, as amended, does it have any significant value? Doesn't the law already allow that as it stands?
The way I read the law is that there's a requirement for the parent to consent for the student to participate in the Medicaid to Schools program. And then there's a second consent required annually to be able to bill Medicaid for the services that are provided. I think the difference where this could change is requiring the explicit written consent every time the care plan changes or is updated. I think within the IEP process, there is also another parental consent requirement. And I think sometimes there's confusion between IEPs and what Medicaid to Schools is. Medicaid to Schools pays for the clinical component. So Representative Murray, to your point, there are IEPs out there that don't really have a medical aspect of it, that there is a consent that happens to that IEP, but we wouldn't have the care plan consent components to that because they can't bill Medicaid to Schools unless there's a clinical component to the IEP. So I think this is really focused on the clinical component of the care plan that's developed, and anytime that changes, there would need to be informed consent from the parent, which is already there's an informed consent that's inherent baseline in clinical practice, but this puts it in statute and makes it explicit.
Well, Mr. Chair.
Yes.
So just to follow up on your response, so if I can extract from that as the law now stands, the parental consent is sort of generic. We're allowing you to do that, and that would cover this. So you really wouldn't need this specificity of this bill. Would that be correct?
I think what this bill changes, though, is makes it explicit that if the care plan changes to add a new service, that the provider, before performing that new service, needs to get the parent's consent to adjust the care plan.
I understand that.
Yep.
But that's like the second stage. Without this, the parent's already consenting. Is that correct? So it's not like it's unknown to the parent.
That's correct. Yeah.
Okay. Then one final. All right.
Yes.
The folks that spoke a minute ago said that the services had to be provided in the school setting, and then they were not quite sure if on the question that Representative Murray brought up about a youngster who had to be at home service. Can you give some light to that, please?
Yeah, so I think a good example is maybe speech pathology, where the student gets speech pathology services at school, and for a certain period of time, maybe they're home based. The school would still provide those speech pathology services, and they could be provided at the home and billed under the Medicaid to Schools program. And I would contrast that between maybe that same child also gets a behavioral health service at a community mental health center or at a federally qualified health center. And while that service may be related to some of the care plan under the IEP, it's not part of the Medicaid to Schools program. They're seeing their sort of independent, private, outside of the school provider.
Great. Thank you so much.
Yep.
Thank you. By the way, very clear.
Representative, no, okay, great, thank you. Representative Selig.
Thank you. And I'm not sure if you were in here when I said I tend to do best getting specific clarification. So if a child is being seen through the Medicaid to Schools program by a qualified mental health professional for anxiety, and the treatment is prescribed that they're going to have X, Y, and Z treatment, and they then also get a diagnosis of ADHD, which is not going to change the treatment, but changes the diagnosis. That changes the billing code, but that would require, based on this bill, a new signature, and wouldn't otherwise. Is that my understanding?
If we're tying the consent to the ICD-10 code that gets billed,
Yes.
that could require the parental consent, additional parental consent, even though that the service provided was within the scope of the care plan that was consented to by the parent.
Okay, thank you.
Yep.
If the service is performed by MSCOG or another private service provider, they would do the billing and they would get the reimbursement from Medicaid. If it was a school employee, on-staff speech pathologist, for instance, the school would, or their contractor would perform the billing and reimbursement would go to the school. Is that correct?
That is correct. Yep.
Okay. Do you have any idea on the dollar amounts we're talking about for Medicaid to School for the most recent year, possibly that is billed to private contractors versus the school itself? You don't have to do it from memory or anything.
I don't have it off the top of my
right.
head, but I can certainly look into it.
Yeah, great. Thank you.
Yep.
Representative Selig?
Thank you. I realize the sponsor left, but I'm wondering, and I don't know if you would know this, but if we start requiring reaching out for parental notification and having forms for every individual change, what the fiscal cost is of the new forms, tracking down people, if we have someone have to discontinue service and schedule additional appointments as a result, what the fiscal impact of that would be, and I don't know if there's a way we can get that information.
I don't know if that was a question for you or
It
not.
might be more a question of the chair. How do we get the fiscal impact of this?
If there was no fiscal note to this, right?
I think some of the costs may be borne, not necessarily within the Medicaid department, but within the school budget to get that additional consent. You know, the administrative costs to getting those additional consents and could be borne there, and you know, maybe some costs would be seen within the Medicaid program if there was a delay in services and the acuity level of the child increased. Because of that delay, we would see costs, just program costs increasing in other areas. But it would be, I don't have a cost estimate that would be able to tie it directly back to that example. Sorry.
Roseanne Murray?
Thank you for taking my question. The question I do have is at what point does age factor into a certain component for consent to treatment with around certain services like mental health care? I do know that there are certain ages in which individuals can consent to treatment on their own. And would this violate any of that? Notifying the parent that there was a change in the treatment plan?
I'd have to look at the various informed consent laws on the books to see how they would potentially interact with this, and whether or not I think a lot of those services are not necessarily Medicaid to school services in the context of like a school-based service to keep a student in the classroom, which is really what the Medicaid to schools program is geared towards. And I think those would be on the, when they see their private provider outside the clinic. Yep.
I was just wondering if this is a Medicaid to schools program. If a child is seeing a private provider outside of the school setting, when does it become additional maybe diagnoses that are outside of the Medicaid to schools program and maybe have nothing to do with the school setting itself? Do you know what I'm getting at?
I think so, but I may need a little more help. Sorry.
I'm just wondering if, since we're talking Medicaid to schools.
Yep.
And, clear if it's tied into an IEP or a 504 plan, but if it's not, it's a separate care plan. When does it go beyond Medicaid to schools, or does it? Is it because the child is in school that it's Medicaid to schools?
I got it now. So the Medicaid to schools program really is the medical component of services to keep kids in the school learning. Whereas I would contrast that from, the where that stops is if they go to their primary care provider for an annual wellness visit, or to their primary care provider for a check-in on the ADHD medication that was prescribed or any other medication that was prescribed, or they go see a behavioral health counselor outside of the school-based setting. That's really where the line would stop. And there's, informed consent in the private practice, but the private practice wouldn't be tied to either the amended legislation or the proposed legislation as written.
Okay, thank you. Any further questions? Seeing none, thank you very much.
Yeah.
I was just wondering also, before you leave, sorry,
No worries.
you thought you were going to get away. Do you have any idea about the language that's in HB2 related to this and in consent, informed consent?
I would need to take a second look at it, but what my recollection is that the HB2 language is tied to if there was a federal requirement to no longer require informed consent or parental consent within the Medicaid to Schools program, that so for example, the federal government prohibits states from doing that the Medicaid to Schools program would then have to wind down.
Right.
But I think the way our current state laws are written, where there is the legislation references it, it's RSA 227-8, which requires informed consent. We have the separate state level requirement for the annual billing to bill parental consent to allow for the billing of the Medicaid component of the service. So yeah, it would be only if the federal government said states you can no longer do this. That would impact. Yep.
Great. Yeah, I think I do remember seeing something like that, but I do plan to talk to the chair of Division 3 today anyway, so I'll clarify the language in HB2 with him. Thank you very much.
No problem.
Becky Wilson? I think we have a call. So I think we did.
Good morning, members of the committee, Chairman Cordelli. For the record, Becky Wilson from the New Hampshire School Boards Association. This is like school. I want everybody to scooch over so I can just look at one group. Sorry. I just wanted to offer maybe a little clarification, if possible, to some of the questions that have been asked around Medicaid to schools, and maybe just offer some assistance if anybody else had further questions that haven't already been answered. Just to clean up, I think the question around House Bill 2, from what I understand and from what I've seen, the language in House Bill 2 does exactly what the previous speaker said, which basically says if ever the federal Medicaid to Schools program no longer requires consent, that New Hampshire will require consent for participation. That's my understanding. It also does allow HHS to go back to the fiscal committee to obtain additional funds for Medicaid to schools if needed. I think that is the only language, excuse me, in House Bill 2 around this issue. I just want to clean up the fact that Medicaid to schools has nothing to do with whether or not a child is getting services in an IEP. The IEP requires that the services are provided. Medicaid to schools has nothing to do with children's individual Medicaid benefits. It doesn't have anything to do with your lifetime benefit or your family benefit. All the Medicaid to schools allows the school district to release with parental consent the fact that the child is getting medically necessary services in the school setting, to bill for those services, and for the school district to recoup a certain amount of that cost of providing the services that they would have to provide regardless, but only if the student meets 3 or 4 other criteria. They have to have, the language has to be in the IEP that it is required service for the student. The parent has to consent that the service is being provided. The student has to be Medicaid eligible, so currently receiving Medicaid, and the services have to be signed off on by a licensed practitioner, for lack of a better term. Somebody in the medical field. Sometimes that's a physician, sometimes that could be a speech and language pathologist, could be an OT, etc. There's a lot of training that happens at the school district level around Medicaid to schools every single year. The technical assistance document for school districts to implement Medicaid to schools, the technical assistance is 97 pages long. It is a very complex program. All of your special education staff at the district level are trained, and all the way down to paraprofessionals every single year, on how to complete the documentation that is required for Medicaid to Schools program, and they fill out Medicaid to Schools documentation on a daily basis about what they're doing with students. And the only students they can include in that documentation are students whose parents have consented that it is okay for them to release the fact that their child is getting those services in the school setting. So it's a pretty complex program. I think people think that, it's a pretty easy thing and somebody at the central office is just inputting some numbers and then the school district is getting a big check. That's not the case either. The reimbursement back to the school district is multiple steps. It comes back as dribs and drabs throughout the school year in checks. Sometimes you'll get a check at the central office that says Medicaid to schools reimbursement. It will list initials maybe of multiple students, and it will be for $7.37. And then I'm not exaggerating. That's the reality. By the end of the year, it does add up, but a lot of it depends on how well your staff are trained on documenting the services, whether or not whoever is inputting the service from a billing perspective. And yes, sometimes that's a billing company for lots of reasons. As you can hear, it's medical billing. Whether or not that's done correctly, whether or not the student was in school that day, they're cross-checking with attendance records. There's a lot of things that are going into this program. So I just don't want it to seem as though, school districts are getting some sort of large cash back. And I think that's why you will find that some school districts honestly don't participate in Medicaid to schools occasionally, because it is a heavy lift from a documentation and a procedural standpoint. And you don't want to go through a Medicaid audit, which happens regularly for good reason. Districts are audited by Medicaid to schools on a regular basis to make sure that they're implementing the program appropriately. And then lastly, I would just again beg to this committee, Medicaid to schools is undergoing an enormous revision right now. The Health and Human Services Department in the state has contracted and put out an RFP for training that they're going to bring in for school districts starting in 2026 to retrain everybody on the new provisions of the new aspects of the program. It's a year-long training that DHHS is going to provide. If you're going to make any changes to consent requirements, I would really respectfully ask that that be incorporated into all the other things that school districts are going to have to try to figure out how to do in order to participate and continue to participate and maximize the revenue that the district is getting back. Because most often those school districts are using the revenues from Medicaid to schools to offset your local tax rate. There's not many other ways that money is often used because it's unpredictable. You can guess at what you think your Medicaid to schools reimbursement might be, but a lot of it again is very student dependent. A parent could decide they would like to not consent to have their children's names released, in which case you're not going to be able to bill for certain services. The child could move. Family could no longer be Medicaid eligible, and not everyone in the school district should know who is Medicaid eligible. Only it's very similar to free and reduced lunch in that way, that it's that's a personal thing that not everyone in the school district needs to know who you're billing for, which is part of the complicated aspect of administering this program. So I'd be happy to take any questions. I can't speak to the amendment. I just got it hot off the press. So,
Representative Selleck.
Thank you, and thank you for taking my question. So I'm going to go back to sort of a case point with the bill as written. If, for example, I qualified for Medicaid to school, my child did, and had muscular dystrophy and was getting adaptive physical education from a specialist, or occupational therapy, maybe a better example, and we'll go with occupational therapy, and they have worked on, developing spoon skills. And we then need to switch to developing knife and fork skills, which would potentially be a different code. The way this is currently written, if I was the OT, I wouldn't be able to switch that service without getting parental consent because of the different billing codes.
thank you for the question. I think that's an outstanding question. So just to sort of reiterate, the student requires occupational therapy in order to access their school environment.
Right.
Occupational therapy also happens to be a medically necessary service. The child also must be Medicaid eligible, and the parent must have consented for you to allow to either provide the service A and also release the child's name to some sort of billing company. OT is covered by occupational therapy. So whether or not within the umbrella of OT, switching from fine motor skills for spoons to fine motor skills for forks is a different ICD code, I don't know. That's why I think most school districts, not all, but most, because of just they don't have the capacity, is contracting with somebody to provide those kinds of oversights to make sure that if you're switching ICD codes, your general special education administrative assistant, as skilled as those people are, and they are very skilled, is also not a medical biller. They don't all have medical billing certification. So I think that's why a lot of times districts are using outside billing companies who are medically billing for these kinds of things, because I can't answer that question. But would that mean that a person at the district level wouldn't also not know, and then would be calling the parent and saying, I need you to come in and sign this new consent for OT because we've switched from spoons to forks? I don't really know.
Thank you.
Representative Murray.
Thank you for taking my question. So with regard to the language being embedded into House Bill 2 and your sort of caution with how things are proceeding with regard to the changes coming forth in training, do you share any concern that this could be putting the cart before the horse and complicating matters that will interrupt service potentially, or as it is currently written?
Thank you for the question, Representative. I mean, if the amendment language is what ends up being in House Bill 2, I think that could certainly, from what I've heard in the last half hour, serve some services outside of the school setting or that are being provided by outside companies that are coming into this, that are, working collaboratively with the school. I don't know how it will impact school staff per se, as opposed to contracted staff. But I also know that it takes, talking about training a lot of people at the school district's level. So I think you need to build in some acknowledgement of time that would take to train people. Make sure nobody is overstepping or accidentally going against the goal of the amendment.
And I will get clarification on HB 2. I had a question. I wish I could. Actually, I'll think of it eventually, but
I'll be here all
any
day.
further questions for Ms. Wilson? Yes, Representative Litchfield.
Thank you. And thank you for taking my question. I feel as though I'm just missing something and I'm hoping that you can fill in the gaps. So when I'm hearing this, I'm looking at it as if the child is getting a new ICD-10 code, then we are notifying the parents and they're giving us consent for billing. So that way we're keeping parents in the loop. And I continue to hear that this is consistent testimony, not you, in general, but parents will drop everything. They have to come in. We may stop treatment. I know even at the state level in our budget, we've added, I think, 134,000 more for DocuSign. So I'm just curious, how do you feel about this? I'm looking at it as if we're keeping the parents in the loop. I would want to know if my child had a new ICD code, to be perfectly honest with you. And I know these days, especially with electronics, we could do something like that. But am I missing something and that's not allowed with Medicaid? Or
Thank you for the question, Representative. Let me see if I can sort of encapsulate what I think you're talking about. So there's two different things, I think, in that question. The first is, if in a child's IEP, I will use speech and language. It's sort of an easier example. But if the child has speech and language in their IEP, they're getting the speech and language. This has nothing to do with that. So in looking at this, the question would be, if the child, what would be the new service that would be getting provided where the parent would not already have to be in the loop? So if the child's getting direct speech and language for 30 minutes a week, and all of a sudden this team feels like, wow, they really would benefit from 30 minutes of group a week, we have to have an IEP team meeting at least, or a conversation with the parents as a team to put that in the IEP anyway, and the parent would have to consent to that. So it has nothing to do with whether or not the child would get the service or not get the service. What I think is a bit confusing, quite honestly, is unless you have a person at the district level who is medically coding the services from the IEP to the Medicaid to Schools program in order to submit for billing, that's where the ICD code comes in. Nobody's putting an ICD code in anyone's IEP. That's just not part of that process because it's a separate issue. So at what point, I guess maybe the clinician that is providing the speech and language services would somehow need to document that the reason they're providing group speech therapy is different than the reason they're providing the one-on-one therapy. And if so, maybe that would change the billing code. And if so, who is sending that consent out? It's a little bit confusing. So I think it's separate from whether or not the child's getting the services. And I think it would be a piece of training as to who at the district level is responsible for gatekeeping the ICD codes as to why a child might be getting a medically necessary service at school, and whether or not the child is eligible for Medicaid, and whether or not the child's parent has consented for the billing. And if all of those things are yes, who's calling the parent to say we're switching from spoons to forks for the previous example? I think it's a training issue in terms of who's responsible for that.
Follow up?
Thank you. But wouldn't those first three steps already be happening?
They would be happening in terms of if you are providing a new service and it changes the goals in the student's IEPs, absolutely, the parents would already be in the loop for that.
Okay, thank you.
You're welcome.
If I could ask, the paperwork involved, consent and so forth, are there standard statewide forms for this, or is each district coming up with their own version of forms? Do you have any idea about that?
Thank you for the question, Representative. There are, as with all special ed paperwork here in the state, there are aspects that must be included on certain forms, and this is no different. Your Medicaid to Schools notification as in terms of what needs to be provided to the parent in writing is consistent. Whether or not there's other things, included in that, I think there's some latitude at the district level, but there are certainly aspects that need to be included. The order and referral form, it might have a different name now, but that's the form that goes to the licensed practitioner to sign off that the services are actually medically necessary to be provided in the school setting. Again, there's some very specific language that needs to be in there, but there is not specifically, to my knowledge, although it could have changed, a form that comes from DHHS that every district must use or something to that effect. But there certainly are aspects of those forms that need to be consistent across the state.
Representative Murray?
Mr. Chair, and thanks for taking my question. Isn't it also true that as if this the billing portion isn't complicated enough and requiring some sort of skilled attention, that the codes themselves can actually change as well? So an individual code for the very same service may, in fact, change and could get kicked back, rejected, and then you're saying, wait a minute, it's the exact same thing, but then you're having to search for the new code.
Thank you for the question. I will say that having served at the district level and overseeing this program, I have never been firsthand the person who is worrying about the ICD codes. That is a billing issue. My role is to make sure that the student's IEP accurately reflects what the child needs at the school setting, and to make sure that we have gone through these gates in terms of parental consent for the IEP, parental consent to release the student's name to Medicaid to Schools, whether or not those things are being billed in a timely fashion, and to make sure that my staff are filling out the forms I need them to fill out on a day-to-day basis to make sure that we are doing this program with fidelity. I don't know who is overseeing the ICD changes, and my speech and language pathologists and OTs are busy with kids. I'm not sure they're in there inputting ICD codes.
Representative Selleck, quickly.
Okay, thank you. Just to follow up on Representative Litchfield's question, if the school is making any change at all to the IEP, whether medically necessary or not, any single change to that IEP requires parental consent. Is that not correct?
That's correct.
Thank you.
Any further questions? Seeing none, thank you very much. Is there anyone else who wished to testify on Senate Bill 34? Seeing none, we'll close the hearing on Senate Bill 34. And in 2 minutes, we'll take up Senate Bill 100.
Occupational therapy is non-medically
That was 2 minutes. And we're on to Senate Bill 100 relative to the violations of the prohibition on teaching discrimination. And we have with us Senator Lang. Thank you for being here, Senator.
Thank you, Mr. Chairman. Thank you, members of the committee. I am Senator Tim Lang. I represent District 2, which is the Lakes region. I'm in my second term in the Senate, where I'm the Chair of Ways and Means and Vice Chair of Election and Municipal County Affairs. I also served 3 terms in the House for the Belknap County District. So what you have before you is, as some of you may know, including myself, who was here when we did this, in 2001, we passed a law that's been termed the Divisive Concepts Law. That law was challenged in court. The court ruled that it was constitutionally vague because it didn't have any kind of specific criteria to it. So to understand what the law does and why the bill is necessary, so I think we'd all agree that teaching these 4 concepts, which are including that any one group is superior to another based on a range of identifying characteristics, that any one group is inherently racist or sexist, that any individual should be discriminated against based on their identity, or that students should treat each other without regard of very varying characteristics. I think we all agree that teaching that to our children is inappropriate, that nobody should be teaching that to our children. That's what the Divisive Concepts Law did, was say, don't teach these topics, don't teach these subjects. These are not appropriate for an educational setting. So, based on the fact that in 2024, May of 24, the federal court ruled that it was constitutionally vague and therefore the law was struck down, this bill seeks to correct the constitutional vagueness that was in that law. So we add a mental state that requires the teachers to know exactly and be clear what they're doing. We basically add 3 words to the entire bill, to the entire current law: intentionally or knowingly. So the teacher knows exactly what to do. They are intentionally teaching that any one group is superior to another based on a range of identifying characters. They're intentionally teaching that, right? I'll remind you that, again, while I don't want to get into the bill itself, other than to correct this bill that's correcting the federal constitutional flaw that they identified, remember that in a prosecution for someone who did this, you have to prove intentionally or knowingly that the teacher did it. It's just like perjury, right? When you're charged with perjury, the state has to prove that you knew something and you lied about it, right? That's what a perjury is. But they have the affirmative action of having to prove it, right? So in this case, this law puts the onus back on the state and says that if an educator teaches one of these 4 concepts, that the state would have, if someone brought a complaint, the state would have to prove that they knowingly and intentionally taught those concepts. That's it. That's the whole bill.
Thank you very much. Questions for Senator Lang? Representative Woodcock.
Thank you, Mr. Chair. Good morning, Senator. Good to see you again. Your new parking space looks pretty good, huh?
I do like my parking space in the Senate.
Yeah, there you go. If I was teaching high school social studies,
sure,
and in the course of my instruction, I was teaching about the KKK, intentionally teaching about the KKK because it's high school social studies, say 1900 to 2025.
Okay.
Would that be a violation of this law?
No, you're teaching history, right? What would be wrong is saying that all white people are racist by that and have an inherent white privilege, and therefore they have an implicit bias on a given sex, gender, or race, and saying that, and because you're white, you must have that too. That would be inappropriate, and that would be wrong.
Okay.
I think you would agree that would be wrong.
Well, correct. That in my, if I can answer that, I would agree. If the chairman let me say that, I would agree. Correct. But that being said, I was just concerned about the fact that I'm intentionally teaching what the KKK stood for, how it was recruited in that sphere of history.
Sure, absolutely. We could talk again in the terms of context, right? Context matters, right?
Okay.
So if you're talking about 1965, the KKK existed and it did this, that's context, right? And you're fine. But if you again made that broad statement that white people are inherently racist, because that's wrong and that should not be taught.
Okay.
But in context, it'd be fine. That's history.
Thank you.
No one's hiding from history.
Okay, thank you, Mr. Chair.
Representative Selleck?
Thank you, and thank you for taking my question, and I believe you represent my mother-in-law's district up at the podium as well.
I do.
And I would bet you know. my mother-in-law.
If you could press your.
Sorry,
Yep.
did I turn it off? I hit the wrong button. So given the same construct, if I'm teaching a health class and I'm teaching about human sexuality or human sexual identity, and I say that any gender identity is fine as part of that class, and I don't say that one gender identity or one belief about gender identity is better than another's, but just that some people are this gender, some people are that gender, some people are transgender, some people are agender. Would that be considered discriminatory in this, or is it acceptable within the construct of a health class or a physiology class to teach that there are different expressions of human gender and sexual identification?
So like, again, I don't see that anywhere in the hypothetical you proposed. Again, the closest it could possibly come to an individual should be discriminated based on their belief or identity. And I don't think you're teaching that an individual should be discriminated against if you just make a blanket statement that there are gay people in the world, there are transgender people in the world. That's a fact, that's a statement. But again, if you say that there are transgender people in the world and they're just kind of confused, they don't know what they're doing, they should, and you should rethink that, they should rethink that. Now you're teaching something different and you're being discriminatory, right? So again, in the hypothetical that you proposed, then no, there's no discrimination in that by just making a statement of fact.
Representative Hall?
Thank you, Mr. Chair, and thank you for taking my question. Do you think this is happening in our schools?
The unfortunate thing about the legislature is we always tend to make laws based on the worst people, right? That's how we end up with laws, because somebody did something stupid and we decide now we got to put a law on it. So do I think it's happening? Yes. Do I think it's widespread? Absolutely not.
Follow-up?
Yes.
Do you know it's happening? You think?
Do I know it's happening? I know that I've had parents concerned about topics that were being taught in school that they felt were inappropriate and shouldn't be taught to their children, this including one of them.
Representative Murray?
Thank you. And thank you, hi, Senator,
Hi.
for taking my question. So the historical constructs of the apartheid, Jim Crow South, 3/5 compromise, reading tests for voting and poll, access to the polls, those types of conversations, I think to Representative Woodcock's position, you state that parents were uncomfortable. Are there murky and gray areas where teachers are put in a position where they are also concerned that they are going to be targeted for teaching the honest representation of historical facts?
No. Again, if it's an honest representation of historical facts, you're teaching history in Representative Woodcock's proposal or a social studies class, and you're teaching about the KKK. I don't think anybody here deny that the KKK existed in 1865 when the Civil War was happening. I don't think anybody would refute that. So it's an honest representation of historical fact. And so therefore, no, I don't think teachers should be confused at all about what they're teaching.
Further questions? Representative Balboni?
Thank you, Mr. Chair, and thank you for taking my question. Getting back to examples, I know that the technical advisory administered by the Department of Education is vague, and it does not necessarily inform teachers as to what is acceptable and what is not. And that tends to be what the issue is. Now, you've mentioned that you have examples of instances where the line has been crossed, as you talked about. What would that be? I mean, would you be able to have an honest discussion about slavery or race where people might say something to the effect of, if you put yourself in the shoes of a slave, how would you feel? I mean, do you feel that something like this could cause a teacher to be accused of a violation?
So again, that I'm not sure where, if you're teaching in context to what was happening at the time in the 1800s in slavery, 1700s in the slavery, I don't see where a teacher could be accused of that, right? Again, you're not making an implicit statement that all white people are racist or all pick your poison for any one of those. That's there. You're not teaching that. You're teaching that this is what was happening and what do you think about it, and have a conversation about it, sure, right? But you're not implying that the person you're asking the question is racist and or should be treated differently because of their race, which is what the bill prohibits. And again, the whole purpose of this is current law. The question is we want to correct the constitutional problem that was with the law, and therefore we put the intentionally and knowingly statutes in it so teachers understand that they have an obligation as well to know what line they're crossing and what line they're not.
Follow up? So I'm still confused. So if I intentionally and knowingly decide that in my class I'm going to put them in a situation out on a plantation, for example, and I'm going to give them roles of either being the slave owner or the slave, does that violate the law?
No. If you're teaching it in a historical context, no. Right? If you're doing you're expanding beyond the historical context and say what happened then, and I think maybe you might start skirting the edge. But again, if you're teaching historical context and you have the facts to back it up, then you're not exceeding. Right? You're not exceeding the authority of the law. Again, those four concepts, I think everybody in this room agrees is a bad idea to teach. That's what we prohibit. You can throw hypotheticals all day long, but teaching that somebody is inherently racist, teaching that you shouldn't treat somebody based on their race, sex, creed, or gender or anything else. I think we all agree those are appropriate things that we should not be doing. So again, you can do the hypotheticals all day long, but I think in the simple reading of the bill is pretty clear. Don't knowingly teach that you're inherently racist due to your gender. Don't knowingly teach that you should treat people differently based on their gender. I think these concepts are pretty simple, and that teachers are well educated and able to navigate this.
Representative Murray.
Thank you, Mr. Chair. Thanks for taking my question. As well as historical instances, like I mentioned, there are certain current day instances in where the facts support conversations around things like food deserts and when we're talking about racism, sexism, ableism, those types of things are happening in schools as well. And I do share the same concerns that Representative Balboni says with regard to current events, that this could put folks in an uncomfortable, teachers, in an uncomfortable position where they are fearful for making a wrong move, for just simply talking about what is happening.
Sure. Again, I think teachers are well educated and are able to define what that looks like. If they think they're getting close to a line, they probably shouldn't be getting close to the line, and they're able to make that decision. These people generally have minimum bachelor's degrees, most masters and PhDs nowadays. And so these people are highly educated and well able to make discernment decisions on where they think they might be pushing up against the line and maybe step back from that line.
Representative Hall.
Thank you, Mr. Chair, and thank you for taking my question. Can you, you think or you know of this happening right now? Can you give me the objectives of a lesson plan that a teacher would have that this would be problematic in?
No. I didn't say I know it. I just told, I've been taught, parents have talked to me about it and said that they feel there are things going on in their school system in education, especially around this topic, that they're uncomfortable with and shouldn't be taught in an educational setting because it tends to be an opinion rather than a fact or that kind of thing. So again, you can give a million scenarios as to how this fits and doesn't fit, and we can sit and argue about it all day long. But the bottom line is, again, the four tenets of the bill, I think we all agree should not be taught. And we should make every effort to make sure it's not being taught in our schools.
Representative Freeman.
Thank you, Mr. Chair, and thank you, Senator, for taking my question. So would this also include religion?
Yes.
So may I have a follow-up?
Yes.
Thank you so much. So would you agree that if a teacher was teaching about anti-Semitism or anti-Muslim sentiment, that teaching about those things is different than teaching about what side you should be on?
Absolutely. Again, teaching about anti-Semitism is different than saying you're an anti-Semite. Right? Those are two different things. And so I think teachers can well make that differentiation and teach about anti-Semitism and if it exists in the world or anti-Muslim behavior, anti-Islam behavior, again, without saying, you're one of these things. I think again, I think we give teachers not as much credit as they deserve sometimes, right? That they're educated people and can make these discerning decisions.
Representative Selig?
Thank you. And thank you for taking my additional question. I two different ones if the chair will allow me. But the first is you've said that parents complain to you about things, and I'm wondering if you could give us a specific thing that a parent complained about, because it's hard for me to grasp with just someone has complained. I'm trying to understand what the complaint is. Whether
I think
my teacher is teaching racism, or my teacher is teaching that my child is racist. Like, is that the
I think the senator has answered that question previously.
with vaguisms? Yes, I'm just asking if there's a specific incident that he might be able to tell us about.
Sure. I'll give one simple example. Palestine and Israel right now, right? This teacher was specifically teaching that Israel was wrong in their actions and that the Palestinians were right and had a component. There are both sides of that argument and discussion. Although the teacher didn't make a decision, what do you think about what's going on? What they said was Israel was wrong, right? And in that case, to me, that's an anti-Semitism argument, right? That they're teaching that anybody who is, if you're on the Palestine side and you're against Israel, you're teaching a form of anti-Semitism. Where some people would argue Israel's just trying to protect their land, but their country, right? And yet that teacher had no reason to step into that argument in that discussion. But they literally taught that Israel was wrong in their actions, and that was one of the examples that was given to me. Inappropriate. Right? For a teacher to be teaching that. You want to teach current context? Great. On October 7th, Palestine bombed Israel. This was the result. The facts going is fine. Again, historical facts matter, right? So teaching an historical historical context is fine. But stating an opinion of things like Palestine's right and Israel is wrong is probably not appropriate for an educational setting in K through 12.
Quick follow-up, please.
Very quick. And just to clarify, well, obviously we can teach that the KKK was a racist organization. Is it, based on your interpretation of this, acceptable for a teacher to say racism is wrong? Or
Sure.
would that be a potential violation of this because maybe the parent believes racism is a good thing?
I think we both agree that racism is wrong.
Is the teacher free to teach that?
Sure.
Representative Murray?
Thank you, and thank you for taking my question. My other question is, do you believe that this bill, as you have presented it to us, satisfies all of the questions that were presented in the finding from Judge Barbaro?
So again, I absolutely guarantee you this bill will be challenged again when we pass this law and make it again, and especially if someone is charged with a violation of it, it will be challenged again, and we'll find out whether or not this meets the criteria. I believe it makes the bill better.
I would just say that the House has passed a bill that is similar to this, but does not address Roman 1 as this bill does. So, we'll see. And there is an existing court case. It's in the First Circuit Court of Appeals right now. And I think that there might even be, there might have been a hearing yesterday in that court. So any further questions for the senator? See none. Thank you very much. Attorney Hewitt? Welcome.
Thank you. I did not think I would be second. Ian Hewitt, counsel for Cornerstone. Cornerstone is New Hampshire's only full-time Christian advocacy organization. We represent a number of churches around the state. And our interest in the CRT prohibition is that after the law was passed, I think it's safe to say we were the primary in-state organization assisting parents in filing complaints regarding violations of the law via the method prescribed in the law. And we certainly want to thank Senator Lang for standing up for the CRT prohibition. And we also strongly agree with him that the existing law is not, in fact, ambiguous in the scope of what it prohibits. What I'd like to talk about is the specific text of this bill. And it certainly is not harmful or objectionable. Changing the scienter requirement does help. That is one of the issues that Judge Barbadaro raised. In his opinion, there were a few paragraphs about scienter at the end of the opinion. But I don't think any attorney, and so far in following hearings about the CRT prohibition, I have not seen any attorney from the DOJ or anywhere else sit here and tell this committee that just changing the scienter requirement is going to overcome the district court's injunction. I really don't think any attorney who has read the opinion is going to say to you, I read the opinion and I believe just changing the scienter requirement will overcome the injunction. That was in the opinion, and we should change the scienter requirement. We agree with Senator Lang, but the vast bulk of the opinion was about the scope of the prohibition. Judge Barbadora's main argument, basically from start to finish, is he thinks that affirmative action or discriminatory policies that disfavor white students and citizens, those are beneficial because they remedy past discrimination. And Judge Barbadora's argument is the law is not clear as to whether it prohibits teaching that affirmative action is beneficial the way everyone agrees it would prohibit teaching that it's good to discriminate against black students or citizens. That was his primary argument. So unless that argument is explicitly addressed, there is no overcoming the district court injunction. That was the bulk of the opinion. The scienter requirement should be addressed too, but that primary argument also needs to be addressed in order to restore the law. And secondly, and quickly, another thing really no one seems to disagree on is no one disagrees that the Department of Education was categorically not enforcing this law. Everyone seems to agree that every single complaint, dozens of complaints parents filed, the Department of Education did not even investigate a single complaint. Everyone agrees. Now, I've seen the Department of Justice, I know they've come before this committee and they've said to the DOE that they have what I think is a very strained legal theory that sort of, if you look at the RSA and squint and look at it sideways, the DOE is not supposed to enforce it. But whether they're right about that is kind of besides the point, because they actually agree. They have not disputed the DOE did not investigate a single complaint. And it's not going to investigate complaints if we just overcome the district court injunction. The law is still not going to be enforced. So based on just the undisputed facts that everyone agrees on, we need to do more than adjust the scienter requirement to overcome the injunction and get the law up and running. And we also need to do something to expressly require agency enforcement if we want the CRT prohibition to be effective and if we want complaints to at least be investigated. Because again, no matter whether you disagree or agree with the substance of these parents' complaints, no matter whether you think teaching that white students are privileged should be treated as a violation of the law, none of those complaints were even investigated. I'd be happy to take any questions.
Thank you very much. Could you explain what a scienter requirement is?
Yeah, the scienter requirement is the mental state requirement, and Senator Lang's current text would add intentionally or knowingly. That is a kind of scienter requirement, and it's common in all kinds of prohibitions, regulatory, civil, criminal, for the prohibition to have a scope of what is prohibited. These are the specific actions that are prohibited, and then also have a mental state requirement. At the end of Judge Barbadora's opinion, he raised this scienter or mental state issue, and he said, this needs to be clear. And so Senator Lang's text does certainly help that, but that was a secondary issue in Judge Barbadora's opinion. The vast bulk of his opinion was about the scope of what is prohibited.
Thank you. Representative Dry.
Thank you. Thank you for taking my question.
Thank you.
So you didn't check opposed or support here. I'd
Yes.
love to figure out what to put down.
Well, we can't say we oppose it, because when we say we oppose a bill, we mean this bill would do more harm than good, and so we think you should not pass it. We don't take that opinion on this bill in this form. It won't do any harm. It will help somewhat, but neither will it overcome the district court injunction even, and neither will it cause the law to be enforced again. I really don't think there's much of an argument to be made that the people of New Hampshire don't, on the whole, favor prohibiting teaching white privilege and critical race theory in schools. And so because the law, I think, clearly has a popular mandate, why just go 1/4 of the way? Why not actually restore the efficacy of the law and get it up and running? And we have a clear path to do that.
Okay, thank you.
Representative Murray.
Thank you, Mr. Chair. And thanks for taking my question. I just want to be clear that I'm understanding your representation of the conversation that happened previously regarding the Department of Justice and the Department of Education. there were conversations about the course of action that first has to happen when there was a complaint. Whether or not the actions were investigated by the Department of Education were determined upon there being an earlier threshold, whether or not those cases made their way to the Department of Education. Is that correct?
Yes, thank you for your question. That is the legal theory of the Department of Justice. They claim that first there must be an investigation by the Human Rights Commission, and then the Department of Education can investigate. If you look at the text of the RSA, there's nothing whatsoever in the text of the RSA that says that. The RSA says violation is a 354A violation, can be investigated and remedied by the Human Rights Commission. And then in the next paragraph, it says violation is a violation of the Educator Code of Conduct and can be remedied by the Department of Education. There isn't anything in there that says first you've got to check box A, then you've got to check box B. It's just got these two enforcement provisions. I've dealt with, on the litigation side, many prohibitions of all kinds of things in New Hampshire where there's multiple enforcement mechanisms. And this is the first time ever, I've been practicing in the state since 2019, that I've ever seen anyone argue because there are two enforcement mechanisms, one after the other. You have to check A before you can even proceed to B. And then just to finish answering your question quickly, that also is a very convenient argument for the Department of Justice to make, because there was a recent audit of our Human Rights Commission that found it has open cases going back to before I was even born, and that oftentimes it takes 7 or 8 years of no investigation, and then they suddenly decide cases without investigating or interviewing anyone. So I don't think any of those complaints are ever going to be acted on.
Follow up?
And then if memory serves me correct, there's yet another option, which was a private right of action, correct?
Yes, you may also sue in court.
Okay.
Further questions? Representative Balboni?
Thank you. And thank you for taking my question. So Cornerstone has legally represented parents that have challenges to the school system, correct?
Well, no, I wouldn't say that. We do represent many clients in litigation, but these are not cases where we signed a representation agreement and pursued a legal action. These were cases where we said, come to us and we'll assist you in going through the process of filing a complaint. And we did assist many parents in filing complaints, but we were not acting as their attorneys.
Follow up, please.
Yes.
Before we were talking about specific instances, so I would assume you would be able to give us a couple specific instances where you have felt that this complaint has occurred.
Yeah, all of the complaints where we assisted parents in reporting violations were complaints where teachers, or say in one case, the school district themselves had material on their district website talking about teaching white privilege. So teaching that certain students are privileged on the basis of their race. That was the principal issue where we said this looks like a clear violation of the law, and we will help you file complaints.
Thank you very much. Further questions? Seeing none. Thank you very much for being here and for your testimony.
Thank you.
Is there anyone else who would like to testify on Senate Bill 100? Seeing none, we'll close the hearing, and we've got a few minutes until we start up with Senate Bill 96 and Senator Lang again. We will move on to our next hearing, which is Senate Bill 96, relative to the mandatory disclosure by school district employees to parents. And welcome again, Senator Lang.
Thank you, Mr. Chairman. Thank you, members of the committee. I am still Senator Tim Lang, and I'm still from the Lakes region. I'm here to introduce Senate Bill 96, the mandatory disclosure by school district employees, or as you read in the short title of the bill on line 1, it's known as the Honesty and Transparency in Education Act. So let's talk about what this bill does. We'll just run right through the 4 chapters. It's pretty straightforward. Section 1 establishes a mandate, right? So the mandate is that when a parent writes and requests information about their child to a school system, the teacher must, or the school district must answer in an honest and complete fashion. And they must do it within 10 business days. So two full weeks, basically. That's what charge number 1 does. Charge number 2 creates an exemption, because if there's a case where a piece of information that the teacher knows might put a child at risk, or is believed to be going to be put a child at risk, and to use the language in the bill, it says, if in good faith determination of the credential holder, such complete and honest response to a request would put a student at imminent risk of physical abuse, physical harm, abuse, and neglect. Right? So again, if the teacher thinks that disclosure of data is going to put a child in risk, then they don't have to disclose the data. However, that triggers the mandatory reporting law. Right? If you think a child's at risk, the child is at risk, because the parents may find out when you don't know about it. And so the child is at risk. So if they're going to withhold information from a parent, then they're going to trigger the mandatory reporting law. The third one is just giving Department of Education the right to adopt rules relative to this new law. And then we talk about what happens on the bottom of the bill, which is a violation is considered a violation of the code of conduct, and that process for violation of the code of conduct to be followed. So that's what the bill does. Let's talk about why the bill is here. I don't think it's a surprise to anybody to say that our citizens' trust relationship with our government is probably at a pretty all-time low, right? The people having problems trusting our government. In particular, parents especially, and I hate to say this word, coming out of COVID, felt that there were things that were being done that they now got observation to, and they were being pushed out of school board meetings and everything else. And they were not being heard, and so they were left with things like 91A to get the resolution, to get information that they want. And school information, as you know, is protected. Our student information is protected by 91A, so they still couldn't get the information they wanted. So this bill is about restoring trust, right? It's about restoring trust of the citizen and the parent in our school system. When we talk about trust, the interesting thing I like to say is, and believe, is that the primary trust relationship in this discussion is the trust of the parent with the school system, not the teacher and the child. That's a subsequent ancillary trust relationship. The primary relationship is that parent is giving the school their child for an extended period of time, and they need to have trust in what's going on. And if they ask a question, they're going to know they're going to get an answer, right? Under the current law, unless the school has a policy, or if it doesn't have a policy, a parent can ask a request and you just be ignored unless it's made a 91A request. There's no state policy that says teachers and schools have to respond to their parents. This bill puts that in place with the goal of increasing that trust relationship. Do I think this is going to be widespread used? Absolutely not, right? But do I think it's needed to help restore that trust relationship between a parent and the school system, or the citizen and the school system? Yes, I think that this bill is needed to do that, and to show parents that they matter and that they're the primary caregivers of their children. They're responsible for the upbringing, not the school system. So that's my short statement. I'm happy to take questions. Again, I think we've done everything. I know the discussion has been around the statement of completely and honestly. I'm going to go back to my previous testimony. I said earlier, our teachers are highly educated. They're highly responsible. I think in the clear and reading of that language, completely and honestly, is pretty simple to understand. I don't think it takes a rocket scientist to do it. Doesn't take a judge to figure out what is completely and honestly, although it probably will end up there. But it doesn't take a judge. You know what's honest. You know what's a complete answer. And you also know when you don't give either one of those two things. And I think a teacher can also figure that out too.
Thank you, Senator. Questions for Senator Lang? Representative Woodcock.
Thank you. Good to see you again, Senator. I'm looking at the item 2, and I'm wondering in item 2 where you're talking about the complete and honest request, but the last part says may withhold only information that creates a risk. I have a concern that there is often information between the teacher, not the school. The school doesn't. School's a building. It's like a bus. The bus doesn't respond. The school doesn't respond. But it's between the teacher, who's the primary person working with the youngster, and that response or lack of response may not rise to the level of a DYS or CHINS referral, as required here. But it is critical to that relationship with that youngster. And that teacher, and perhaps that youngster's future, or the concern at home, or whatever it happens to be. But it may not be a CHINS or DYS referral, right? So I'm wondering what happens there. Because it seems to me, having been in the classroom for multiple years, that teachers and students often come to a trusted adult, coach, teacher, faculty member, custodian, someone, and talking about something because I can't talk to my parents about it. I can't do it. You know, they're we're teenagers. We don't talk to our parents. You know, not usually, but I can find somebody to talk to. But it doesn't force me to go to file a request for CHINS.
So the simple answer I'm going to give: a teacher should never keep a secret, should keep secrets from parents. Period. Right? Unless there's good cause. Good cause isn't just because it violates a trust relationship between a teacher and a student, because that's a terrible standard, right? Teachers should never keep secrets from parents, right? We give the one carve out. If this is going to cause harm, absolutely don't tell the parent and file a report. But just because the student tells his teacher something doesn't mean that the teacher should be in a position, if a parent asks, not to tell and keep a secret. That's a terrible public policy, to say that the public policy is that teachers are allowed to keep secrets from parents.
Follow up, Mr. Chair?
Yes.
I don't like the word secrets. It gives a very negative connotation to the teacher and the student. But I would agree but I would disagree with that. I would say there are things that aren't secrets in the term that everything goes, you got a secret, like I tell the parents. They're not keeping secrets from parents. They're taking a dialogue between an adolescent and a teacher who's looking for some help. Who needs to just bounce something off them.
Again, my statement stands, again, in a situation where a parent asks a question and you don't disclose information. I'm pretty sure in any marriage, your wife or spouse would say you're keeping a secret and you're not telling the truth. So again, I think the information is that teachers, and I view this as a pro-teacher bill, to be honest with you, because now teachers are relieved from this burden of keeping secrets, or what do I tell or what don't I tell? They just have to tell the truth unless there's a reason not to. That's simple. It's a simple statement, right? It actually is easier for a teacher, in my opinion, because now they don't have to decide what can I say, what can't I say, or anything else. The simple answer is I tell everything. I answer honestly, I answer completely, unless there's cause not to.
My last follow-up.
One more?
That's it. I think this is an anti-student bill. I think this negatively impacts students significantly, because they need someone to speak with. And if they can't feel they be comfortable in the classroom. Thank you.
So again, I'm going to go back. The primary trust relationship is between the parent and the school system, not the teacher and the student. Don't break the primary trust relationship.
Senator Lang, am I correct in that the communication in this legislation is from the parent to the teacher? The communication is initiated by the parent, not initiated by the teacher.
Correct. There's no disclosure a teacher must run out and tell a parent something. The question is if a parent asks. I only use this example because this is usually where the conversation goes. We talk about students who have disclosed to a teacher they're gay, they're questioning their sexuality, or they're questioning their gender, right? Now, at the same time, we know as a statistical fact, those students are at greater risk. Would we all agree to that? Those students are at greater risk for being vulnerable, for self-harm. They're at increased risk. I'm a father to 4 kids. In every one of my children, I have had an ebb and flow relationship. There are times they tell me things I wish they didn't tell me. And then there are times where when I ask them questions, I get, how was the day today? Fine. You know, anything happened? Nope. And that's all I can get out of them because that's how it works, especially with teenagers. As you get into the teenage years, that's how it works with parents, right? So the question is this. The question is, if I recognize something's going on with my child, they seem depressed, and I'm trying to talk to them, but I'm getting the nope, yep, and that's all I'm getting for answers. Isn't it logical that I would go to the next most trusted adult, the teacher, and say, hey, what's going on with my child? Think they're depressed. I think something's going on. You have them for the most time other than me. So what's going on? And wouldn't it be reasonable to have a truthful answer, especially in light of the fact that we also know, we said those children who are gay or transgender that have disclosed that to the teacher and haven't disclosed it to the parents are at risk for self-harm. And they don't do self-harm at school, right? They do their self-harm at home or somewhere else. And you're going to withhold the information that a parent should know to protect their child, to make sure they don't do self-harm, because you want to keep the secret of the student. I think that's wrong. I think that puts the school at risk for a wrongful death suit if it proves that the teacher knew that the child was at risk and did not disclose that data, and then the child hurt themselves. The school's responsible for that because they could have prevented it by telling the parent what they knew when the parent asked. So I think it's very bad public policy to allow teachers to keep secrets from parents, and if they know something and they're asked by the parent, they should tell the complete and honest truth to the parent.
Representative Kluger?
Thank you, Mr. Chair. Thank you, Senator. Would this include guidance counselors?
So we have some carve-outs in law, and that's always the guideline to begin with first, right? So there are guidelines about health information, some other things that we've already have in law that a teacher is not legally able to do, and I think we talk about what they're legally able to disclose. But again, if there's an exception in law that says that a teacher can't talk about this subject, whether it's a guidance counselor or otherwise, then they should follow the law. FERPA is a great FERPA is what is called the federal right protection information. Right, there are some things that can't be disclosed. Follow up.
Okay, yes. The follow-up would be, so do you feel that this bill in any way takes away the rights of students, privacy rights?
Again, I think we've codified the privacy rights that students are entitled to in our law, and nothing forces the teacher to break other laws that are within our statute. However, so if the teacher feels or the superintendent feels that the disclosure of the data would violate another law, they're welcome to withhold that information because there's already a law. They're not required to release it.
Thank you.
Representative Freeman?
Thank you, Mr. Chair, and thank you, Senator, for coming in front of us again. So would you agree that this would also be helpful with children who may be facing problems with addiction, such as drugs or alcohol, to if they do go to a teacher and the parent does inquire about that?
Absolutely. Again, like I said, the ebb and flow nature of being a parent with their relationships with their children, again, the next most trusted adult is the teacher. And why wouldn't you go to that teacher and ask a question? If the teacher knows the kid's struggling with addiction of some sort, should tell the parent and say, hey, your kid's got a problem, came in, whatever the issue, whatever the topic is. But they should tell. Again, a teacher should never be put in a position where they should be able to, they on a personal decision, decide to keep secrets.
Representative Hall?
Thank you, Mr. Chair, and thank you for taking my question. Do you see this bill ultimately really putting the teacher-student relationship at risk, where students feel comfortable and all of a sudden, the teachers don't want to go there, so that's the question.
Well, again, I'm just going to say that the primary trust relationship is with the parent, and I think this bill will enhance the primary trust relationship.
Any further questions for the senator? Representative Balboni.
Thank you, Mr. Chair, and thank you for taking my question. So the House heard a bill, and this appears to reference directly the Teacher's Code of Conduct and Ethics. However, the section that you have put it in is a totally different section. So I'm curious why this is separated out. Because, as you know, there is a code of ethics, and it does reference communications with the public already. I mean, and this is a very specific instance, so that's one question.
Sure. So in section 3, we say that the State Board of Education shall adopt rules pursuant to 541A, the rulemaking authority, to amend the Code of Ethics and the Code of Conduct for New Hampshire educators relative to this section. So they have to go in and edit their rules. And then the very next section, we say a violation of this section shall be considered a violation of the Code of Conduct for New Hampshire educators and subject to investigation in accordance with the administrative rules for that credential holder. So again, we have a set of ethics and guidelines for teachers. If they violate that, there's already a process in place for what happens when the teacher violates it. I'm not creating a new process, right? It just says that this is now subject to that process.
Follow-up?
Yes.
My follow-up has to do with a specific program that's offered and promoted in the Department of Education called One Trusted Adult, which encourages students to seek out adults when they're not, when they might be in situations where they're not comfortable talking to someone else. And this seems to go in direct violation with that particular program.
Oh, I completely disagree. I completely disagree. I think that, again, we want to encourage, if a kid's having a problem, to go seek help wherever they think they can find help. But remember, that doesn't take away a parental's right to know what's going on with their child, right? Just because they talk to a teacher doesn't mean that that teacher should keep the secret. It means that if you want to go talk to him, you go talk to him. And if they give you great advice, fine. But if a parent asks a question, you should not withhold that information, because it's not the teacher's responsibility to raise that child. It's the parent's responsibility to raise that child.
But again, just to follow up with that, the program specifically states that if the child goes and talks to the teacher, that the teacher will keep that information within that conversation. So you're asking the teacher to pretty much violate the program that the Department of Education has promoted.
So thank you for the question again. No one is requiring that the teacher, as soon as they hear what the student says, to run to the parent. The question is, when a parent inquires, and there's generally going to be a cause, an impetus for the parent to make a request. They're not going to do it. They may just make the phone call and say, hey, do you know what's going on? And if the teacher thinks that information is a cause for abuse and neglect, we've created that carve out. But again, the primary trust relationship should always be between the parent and the school, not the teacher and the student. I don't understand the concept, with the exception of abuse and neglect, why we should be promoting any public employee to lie to its citizens. I just don't support that. And that's what this bill is saying, is that I think it relieves the teachers and makes it easier for them, myself, because now they don't have to deal with it. They're going to, if I'm going to tell a parent everything that's going on, with the exception of if that puts that child at risk, and then I'm not going to tell them, and I'm going to file my complaint, my report. I think it relieves the burden to teachers for this. And we may disagree on that, but that's my opinion. And that's what I think the bill does.
Representative Hall.
Thank you, Mr. Chair, and thank you for taking my question. Just to follow up, do you think teachers would agree with that statement, that it relieves them? If you surveyed 10 teachers, public school teachers right now, and said, do you think that this relieves you of the pressure of having that relationship with students, do you think that they would agree with you?
I think it's an actual factual statement that it relieves them from the idea of trying to decide what to tell and not tell. I think that's a factual statement. This law would do that, would relieve them of that burden. They only have one decision to make. If I disclose this, will it put the child at risk? If the answer is yes, this is what I do. If the answer is no, then I tell the truth. That's it. That's what the bill does.
Representative Murray.
Thank you, and thank you for taking my question. So are you filing this bill under the impression that teachers are already not communicating things to parents? Because in my experience as a parent of 3 children in the school system, there's regular communication all the time about subject materials, missing assignments, you name it. So I am curious to know if there's a specific instance you are concerned with around, quote, withholding information, or do you believe that teachers are actively operating this way as a standard?
Thank you for the question. So again, I think it goes to, there's an erosion of the trust relationship with parents, with the school system. The purpose of this bill is to rebuild and re-encourage that trust. So parents know if they ask a question, they're getting an honest answer.
For Representative Nato.
Thank you, Mr. Chairman. Thank you for being here before us. In Roman numeral 2 here, it says, for imminent risk of physical harm, abuse, or neglect, or actually any part of it where a child's having an issue, depending on the issue, shouldn't it be like a third party to mediate between the parent and the teacher and the student to try to figure this out? So, because the parent's the one who's raising the child.
So again, I one of the other hearings I had, someone was talking about this concept and the argument about, you know, if a student said to a teacher the student just failed the test, that my parents are going to kill me. Is that an honest statement that says the kid's really at risk? No, right? It is a statement, you know, we all make those kind of statements like, oh, I'm dead, right? I'm screwed. Whatever you want to use for a phrase, right? So does it put the child at risk? Absolutely not. The goal of this is, again, this would be a report to DCYF, or I don't know what they call it nowadays, DCYF, and that would be investigated based on the complaint. If the teacher decides that disclosure would put the child at risk for abuse and neglect, and I say the risk exists and it would require them to report, and then that independent agency will decide whether or not it's a real risk or not.
Any further, Representative Murray, one more?
Thank you. So with regard to, you know, teachers answering honestly and truthfully, I believe that their intention is already there. That is already happening. However, what happens when children are exploring with their sexuality or their gender identity, right? Those things are very fluid.
Mm-hmm.
And that information then gets communicated to a parent and perhaps is maybe incorrect. And you've just forcibly outed a student as a result of information where the student has not yet figured out fully for themselves where they're at in this process. And so this situation puts a whole lot of things into one area where now the student and the parent and the teacher are in a mixture of a very complicated situation here where the student may not yet have been ready to have that conversation.
So again, thank you for the question. I'm going to keep going back to my standard statement. The primary trust relationship is between the teacher, the school, and the parent, not the student and the teacher. So again, and I'm going to go back to my example. I have 4 kids. If I was in the ebb side of that conversation, I want to know what's going on. If I see my child being depressed or anything else, and I go to the school and say, I've asked, I can't seem to get an answer. Do you know anything that's going on? I would expect I get an honest answer, especially if they know what's going on. They go, yeah, your kid's struggling with his gender. The kid's struggling with sexuality. That's what's going on. And if that means the parent and the kid now has to have an uncomfortable conversation, so be it. But again, the primary trust relationship is between the school and the parent, not the teacher and the student.
Thank you very much, Senator. Thank you. Sarah Terrell.
Good morning. Thank you for hearing me today.
Good morning.
My name is Sarah Terrell. I'm a lifelong resident of New Hampshire and the proud mother of 2 amazing kids. My son is 18 and thriving in his first year at college, and my daughter is a 16-year-old dedicated sophomore. I'm here today because I have deep concerns about SB 96, which would require mandatory disclosures by school employees to parents. At its core, this bill assumes that parents and educators are on opposite sides, that we need government intervention to force honesty. In my experience, that's just not true. Parents and teachers already work together every day, communicating openly, building trust, and supporting students in ways big and small. This bill doesn't strengthen those partnerships, it undermines them. What worries me most is how this bill could force schools to disclose a student's LGBTQ identity before they're ready. When my daughter came out to me, it was a moment of immense trust. I could see how anxious she was. Even though she knew we loved her unconditionally, she was still afraid. That moment belonged to her. If someone else had made that disclosure on her behalf, it would have shattered something sacred in our relationship. Not all kids are lucky enough to have supportive families. For some, being outed could mean rejection, abuse, or worse. SB 96 includes a clause that says if a teacher believes a student may be at risk of harm, they should file a report with DCYF. But there's a huge problem with this. New Hampshire's Child Protection Law, RSA 169C, does not allow DCYF to investigate reports based on potential or speculative harm. They are not minority reports. Reports must be based on harm that has already occurred. This means that this bill gives educators a false sense of protection. It offers them a reporting mechanism that legally cannot act on concerns about what might happen. This is a dangerous oversight. It puts teachers in an impossible position and it leaves vulnerable students exposed. SB 96 claims to protect parental rights, but it does so by stripping away students' rights, their privacy, their safety, and their dignity. That's not the kind of policy that builds trust. It's the kind that creates fear. And I'll be honest, it's disheartening to see how little weight seems to be given to opposition testimony like mine. It often feels as though Republican leadership is more interested in making a political point than in listening to real families with real stories. I hope that today can be different. I hope that you'll hear the voices of parents, educators, and students who are pleading with you to stop doing harm in the name of transparency. Please vote ITL on SB 96. Trust our educators, trust our students. Let families have these conversations on their own terms, not under the threat of state law. Thank you.
Thank you. Any questions for Ms. Terrell? Representative Woodcock?
Good morning. Still morning. Good morning. Just a quick question. Senator Lang referred to he believes this bill is primarily between the parent and the school has the primary focus, and that is more important than the teacher and the student. What would be your thinking on that?
Thank you for the question. I, having two children, never ever experienced a moment where I thought that a strong relationship between my children and the teachers was less important than my relationship with my children. We have a good relationship and I was never worried about that, but if there was ever a thing that they didn't feel like they could talk to me about, I wanted them to have people in their lives that they could talk to, just like the One Trusted Adult program. I want them to be able to talk to other people, even if it's not me.
Thank
Always.
you. Thank you, Mr. Chair.
Any further questions? Seeing none, thank you very much for being here. And if you would mind sharing your written testimony with our clerk for the record?
Yep.
That'd be great. And you can just hand it to the gentleman at the end. Thank you. David Trumbull?
Good morning, Mr. Chairman and committee members. My name is David Trumbull. I'm from the town of Ware, and I oppose this bill for a couple reasons. First of all, I think it goes against the Constitution of the state. This case was basically decided already in August of last year in Doe versus Manchester School District. It was a case involving whether the school should be forced to reveal a student's LGBTQ status to the parents. And this court decided that the Manchester policy was appropriate. They answered the question, should schools have to tell the parents completely and honestly everything all the time? And the answer is most of the time, yes, but all of the time, no. The court based their decision solely on the New Hampshire Constitution, and they did it for three reasons. First is they said that parents' rights, while important and fundamental in the school setting, are not an unqualified right, and that's a quotation from the court decision. Second, they said that the school policy did not place any limits on the parent's ability to parent her child as she sees fit, and if there were any interference, it would not rise to the level of a constitutional dimension. And third, the court said that parents have numerous other self-help remedies. They listed 8 other ways that parents could assert their parental rights and learn information about their children completely independent of the schools. The second reason I oppose this bill is I think that it actually reduces honesty. Children have the right to live an honest life. That means to be authentically who they are themselves. That includes having conversations with trusted adults. This bill removes that ability from children because they will know that that trusted adult is no longer someone they can trust because they will have to tell everything that they said to their parents. Right now, you have a balancing of rights, the parents' rights and the children's rights. This bill gives 100% of the weight to the parents' rights and 0% of the weight to the children's rights. That is not the way we should do things. And the reason is that it will harm children in a couple of different ways. First, it will increase teenage homelessness as one example. We know that 14% of LGBTQ youth have been abandoned or kicked out of their homes. And of those, 40% due to their LGBTQ identity. In other words, for most parents, if their child is gay, life will go on. The parent will support them. But there are many parents who won't support their children. And that is what that trusted adult is listening to, is saying, in this case, if I tell that parent, I risk having that child be thrown out onto the street. That's a real harm. It's a quantifiable harm. And it's far different from the scenario that Senator Lang gave you, which is that, well, if you tell the parent the child is gay, then the parent will somehow help the child's mental health. That would be true if the parent is supportive. But in that case, the parent isn't going to go to the teacher and ask for the information. It's the situation where the parent won't be supportive are the ones that we have to be concerned with. The other impact is going to be the loss of the trusted adult. Students want to talk to adults. The teacher under this bill is going to tell students, don't start talking to me because if you do, I'm going to have to tell everything you say to your parents. That relationships will corrode. It will erode. There won't be trusted adults anymore. And what difference does that make? We know that when there's one trusted adult in the life of children, not just LGBTQ children, but all children, the risk of suicide goes down 40%. And that's a big deal because suicide is the second number two cause of death amongst teenagers in this country. A trusted adult reduces suicide. This bill will erode the ability for children to have trusted adults. I think that's all I have to say. Thank you very much.
I just wanted to clarify one thing you just said. I had gathered from the senator presenting the bill that the communication was from the parent to the teachers requesting information. I think you mentioned something in the opposite direction. Did I misunderstand you? In that basically the teacher had to tell the parents.
Thank you. If I said that, that's not what I was intending to say. The Manchester court case was very clear. It did not hold that teachers can't talk to parents. That's still available. What the court held was that in every single situation, they are not obligated to tell the parents because the parents' rights, although important, and I understand, I'm a parent, 2 children, went through public schools, the parent's right is not an unqualified right in the school setting. The court looked at this and said, children have rights, the schools have to run their schools, those rights have to be balanced with the parents' rights. And so they said, in all cases, no, schools don't have to say everything to a parent. Did that answer your question?
Yes.
Okay, thank you.
Further questions for Mr. Trumbull? Seeing none, thank you very much for being here. Zoe Hill?
Good afternoon, representatives. My name is Zoe Hill. I am a resident of Lebanon. I'm here to testify in opposition to SB 96. Adolescents deserve a certain amount of privacy from their parents. They should have safe spaces to share information they would not like their parents to know, whether it be as insignificant as a birthday present they're planning, or as significant information like their gender identity. This bill will create a chilling effect that will eliminate many children's only safe spaces, other than their parents, their teachers. When children do not have safe spaces to freely speak their mind, it puts pressure on their mental health, which can even lead to self-harm and suicide. Vote ITL on SB 96 for children's mental health. Thank you for your time.
Thank you very much for being here and for your testimony. Are there any questions for Ms. Hill? Representative Nadeau.
Thank you, Mr. Chair, and thank you for testifying in front of us. So I know you mentioned suicide. We want to we don't want anybody to do that. We want everybody to flourish. I have children and grandchildren in the school system now, and God forbid we don't want any issues like that. We prefer to mitigate that in somehow. So, again, like I questioned before earlier, what about like a third-party mediation between parent, teacher, and the student? Because the student's number one, and their safety is number one in education. So, what about a third-party mediation?
Well, I think having a third-party mediation does also infringe on a student's right to privacy. I'm very often when there's a custody battle, there is a third-party person, but not every single student needs to have their privacy shown to multiple people. I think it is not, keeping some things secret from a parent is very normal for students to do. I mean, I'm 18 years old. Certainly when I was in high school, I kept secrets from my mom. Like, that is a normal thing. And not all secrets have to be shared.
Representative Freeman.
Thank you, Mr. Chair, and thank you for coming in front of us. I understand the importance of privacy, no matter what age a child is. Where do you draw the line on privacy? And I'll pose the question to you that I asked the senator. This isn't just about gender. What happens if we have a student who is suicidal or has a drug or alcohol problem and goes to a teacher? How do we address that without legislation like this?
Well, I believe that there are already laws. I mean, teachers are mandated reporters, and if a student tells a teacher that they have an addiction or that they are really considering suicide, teachers have to inform the correct authorities already.
Follow up? Yes.
And I can appreciate that, but additionally, don't you think the parent should have some involvement in that? I mean, that if I'm a parent as well, I would want to know if my child was struggling with drugs or alcohol. Don't you think a parent should have some involvement in that?
I think that most parents, when confronted with the fact that their child is facing severe mental health crisis, are really concerned and feel a lot of compassion. But there are some parents, not many, but who see that as a weakness and would punish their child, perhaps, for being suicidal. And that is not at all the case for a majority of parents. But even if just one child is harmed, shouldn't we not pass this bill?
Thank you.
Further questions? Seeing none, thank you very much for being here. Nice job. Oh,
I just want to clarify that if a student tells a teacher they are feeling suicidal, they must report it and to.
I think
that's
there
just-
are suicide policies and
Yes, that's not
issues on
something
the
you keep
books. Yes,
secret.
right,
No.
yeah. Right. Brian Hawkins?
Thank you, Mr. Chairman, members of the committee. For the record, Brian Hawkins, representing NEA New Hampshire. We're here in opposition to Senate Bill 96. First, I would like to say it's unclear what people who are sponsoring this bill are trying to achieve by passing this legislation that frankly can't be accomplished today. Teachers, just to sort of set the record straight, teachers are trusted people. Educators are trusted people. That is true across the board whenever you see public opinion polls done, when you ask parents, overwhelmingly, these are trusted individuals. And as I mentioned, in previous hearings, educators welcome the discussion about questions with respect to how their child's doing in their class from parents. If there's an answer to a question being given by a teacher that somehow is unsatisfactory or untimely to the parent of a student, especially if that is something that is outlined in a school district policy, then that's the sort of issue that ought to be addressed with the principal of the school, or possibly someone in the administration. At the school district level, it's the principals and the administrators who are responsible for enforcing school board policies and managing school employees. They would be the ones who would be directing or guiding staff if there are certain types of questions that ought to be run through a school principal or possibly require some kind of additional guidance. However, if a school district employee is following a school district policy and a parent does not agree with that policy, it is not the employee that has the latitude to disobey that policy or directive by the people who are supervising them. This bill seems to create this parallel process and penalties to the one that's established by a local school board. So I'll go next because there's been a lot that's been covered today already, but a couple of things. First, in the bill with respect to material information, who is the arbiter of what is material information, or whether an inquiry has been answered completely or not? That's unclear. During the Senate hearing, I think it was last year, the Department of Education testified that the standard honestly and completely was subjective and would be difficult to enforce. That's in the hearing report, which I'm happy to provide if you would like. Secondly, completely and honestly, to the extent permitted by state or federal law, the concern here is regarding the position the educator is placed in here. So I don't agree that this makes it easier for the educator. This can force the educator to juggle some competing interests, determining first what is material, then deciding what is a complete answer and whether too much detail violates some state or federal law that they may not be aware of. Because again, this goes to the educator, not to the school, not to the school administration. This goes directly, bypasses right to the educator. So they've got to determine that and then make the determination about whether that complete disclosure is going to risk a student's safety. So this is an added pressure and the bill additionally outlines a specific time frame in which that answer needs to be provided. So these preceding questions cause us concern because those inquiries could fall under this law, that could fall under this law are outlined in employment protocols for educators, the ones that they are used to following. And since this law puts all of the onus, as I said before, on the licensed educator receiving the inquiry, is the school district obligated to provide them the guidance they need if there is a tricky question? I mean, 99.9% of the questions are the ones that are easy, where it's about homework, it's about how the student's doing in class. These are all the sorts of questions that, as I said before, educators welcome. So just in summary, the bill sets up, we think, a confusing and actually an intimidating process for an educator in a school that's not going to serve the students in furthering their education. And we would respectfully ask you to find this bill inexpedient to legislate. Happy to take any questions, Mr. Chairman.
Thank you. Questions? Seeing none. If you have written testimony, you wouldn't mind submitting that up to our clerk?
I do. Yeah. I scribbled all over it.
Oh, okay.
So I'm going. But I will be happy to submit a clean version of it.
Great. Thank you very much.
Absolutely.
Deborah Howes.
Good afternoon, Chairman Condelli and members of the House Education Policy Committee. I am Deborah Howes, President of the American Federation of Teachers. I am here to speak against this bill. Much of it's already been covered, but we are concerned that this bill would get in the way of teachers and parents working together as partners in the best interest of students, because that's when students thrive in our public schools, when they have the support of both teachers and parents looking after their academic success in schools. We do have concerns about the standards in here in part one, as we were just hearing about. Completely and honestly, in most other places you find that in law, it's dealing with very tangible things like assets being divided up in a divorce or in a bankruptcy, things you can prove exist or don't exist. If you're talking about that in a school setting, if you're being asked about grades, test scores, whether a student is following the school rules, whether they're genuinely getting along with their students in the class, fellow students in the classroom, that's something that can be answered completely and honestly, because those are observable and measurable things. But regarding material information, that opens up a much wider category that's not defined in this law. So you're asking teachers to notice and keep track of things that they may not know are significant to a parent. It may not rise to the level of the teacher paying attention to it. And then how do you prove that you have completely and honestly answered a question asked in writing when a parent asks it? My student Samantha may decide she wants to be called Sam. Am I supposed to follow up and ask a bunch of questions about why? What if James wants to be called Jim? Maybe they just want to go by a shorter name. If I ask a bunch of questions, am I then opening a can of worms and have to essentially Mirandize the student and tell them that anything they tell me, I have to report back to their parents? You might be asking teachers to go further with what's really just a simple request to be called by a shorter name so that I can answer that question the parent's going to ask later completely and truthfully. This really is asking teachers to probe much deeper into things than maybe is intended. As was also mentioned, parents' rights are not absolute. Our New Hampshire Supreme Court has found that most of the time they are, but not every single case 100% of the time. Students do have some rights. And the carve out in Section 2 does not have the correct standard either. It gives a false sense of security because we cannot, DCYF cannot act on abuse or neglect that has not happened. So if a student genuinely, honestly believes they are in danger, you're telling a teacher, well, yeah, I don't have to report it, but in fact, DCYF can't do anything. So you've given a teacher, a false sense that conflicts with our existing laws, and you're making them betray the confidence and trust a student has placed in them. And that's just wrong. We should not be putting people in that position, and we also should not be threatening to take away their jobs if they, in the very few limited circumstances where a student is genuinely going to be in danger, but it hasn't happened yet. And we shouldn't be forcing teachers to make sure a student is actually harmed before they can keep the trust a student has placed in them. So for these reasons, we think this law is not one that should be passed. If you can think of ways to work through it to avoid the problems we've outlined, we would love to see what you come up with, because we really think that parents and teachers should be working together in the best interest of students, because that's how students succeed. Thank you.
Thank you. Representative Murray?
Yes, thank you. And thank you for taking my question. I am curious about the words completely and honestly. Most situations where I have heard that conversation have been under oath when somebody is testifying somewhere in a court of law when they're raising their right hand. Why would that word choice be placed in an RSA statute in addition to it being anything other than...
Maybe you could rephrase the question. I don't know if she knows why that phrase was used.
If there is a different phrase that is less legalistic, I mean, because I do believe teachers are honestly responding to questions. So I'm confused as to why the legalistic word, I guess, there.
I didn't write the bill either.
No,
so, and again, in my experience, when you're asked a question about something that you have every reason to know about, you answer to the best of your ability unless there's a really good reason, like a child has told you they are in grave danger if you pass this on. Like, you know, a high school student has come to you and disclosed a pregnancy scare. And they're afraid they're going to be homeless or beaten because of it. Yeah, this isn't just about sexual identity or gender identity. It could be something like that. That might be something where you want to give the student a little bit of time to figure out how to talk to the parent. And of course, my very next step would be, let's get together with guidance, because now we have to figure out how to get you taken, you know, how to get you the help you need.
Any further questions?
Yeah.
I did have a follow-up. I'm sorry.
Follow-up?
Thank you. I guess to that extent, I guess, are we expecting an educator to have a book with them that carries, like our red book here, this is our state laws. It's a state and federal laws. So again, I think somebody else spoke to the onus of there being a higher entity that has the oversight decision-making on the administrative side of education. So how does anyone determine that they fully understand the state or federal law before they're responding?
That we have to have them all memorized and, you know, in every single moment, keep them in mind and keep track of everything while we're teaching the standards and, you know, making sure nobody's bullying anyone and making sure that that thing that looks like a thumb drive is not really a vape, and that we're up on the latest, the latest emergency drills and.
Okay, I think we're a little bit beyond the scope of the bill. Are there any other?
But we are talking about, we are asking teachers to notice every single moment of every single day.
I get that. Thank you. Are there any further questions? Seeing none, thank you very much.
Yeah.
Representative Moffett.
Thank you, Mr. Chair. I wasn't planning to say anything, Representative Mike Moffett from Loudon, but I did want to touch on one point quickly, because I keep hearing again and again and again about students seeking out adults or looking for a trusted adult. I keep hearing that again and again. And my concern, which I share with others, is that we're creating a cultural expectation that a teacher should be the default trusted adult. And I think that's a cultural assumption or a cultural expectation that we need to counter a little bit, because I think, and many of us think, that we've somehow evolved culturally to a place where we're expecting teachers to do things that we never used to. I think the trusted adult may, if it can't be the parent, sometimes it can't be, I think that if the trusted adult could be a grandparent or an uncle or an aunt or a clergy person, a neighbor, a policeman, you name it. So that's the one point I wanted to make, is there's a concern that, and I'm a former teacher, full disclosure, a former student of mine, I'm going to see at 1 o'clock, who asked me to put a bill in that I'm introducing to a Senate committee. But that former student came to me because I'm a lawmaker, a specific reason. We're hearing a lot about transgenderism or sexuality, and I'm a lawmaker. And I think a lot of teachers are not trained counselors or therapists. So that's my one point I wanted to make. And I support this bill. I'm a co-sponsor. And I think that this bill helps to counter this emerging cultural assumption that teachers need to be the default trusted advisor. So that's my one quick point. Thank you, Mr. Chair. I'll take questions if there are any.
Any questions? Representative Cornell.
Thank you. Thank you for taking my question. So if the teacher shouldn't be expected to be the trusted adult, and they should go to an aunt or an uncle or a grandparent or a neighbor, and they tell them something, and then the parent calls the next door neighbor and says, what did my child talk to you about? Or they call the grandparent and they say, what did my child talk to you about? They should be open and tell them too, so that that's no longer a trusted adult for them either?
Yeah, I'm tracking you. I think it gets your point. The difference here between the other trusted adults and a teacher is that a teacher is a public government employee, and there's all kinds of potential liabilities that go with that don't accompany a trusted adult who is a neighbor, a relative, a policeman. Well, a policeman is also a government employee. But I think that's the difference.
Coach?
You know, I was thinking of, as a former coach, I think a coach is a teacher. And I think a coach, and there are some coaches who are not, as you know, part of a school structure. So coach, and this happens, I know it does, you know, some coaches who come in are not teachers that become trusted adults. And I think the same concern is there, though, that a coach or teacher should not necessarily become the default trusted advisor. So that mentality, I think, is a concern that we want to counter, and I think this bill helps to do that.
Any further questions for Representative Moffett? Representative Hall.
Thank you, Mr. Chair, and thank you for taking my question. Do you think that teachers, when they get this information, if a kid came to me and said, you know what, I'm thinking about cutting, you think I'm going to own it, or am I going to pass that on to the guidance counselor, or am I going to get another person to deal with it? I mean, I think there's this sense, I'm hearing that teachers, you know, get this information and just kind of hold it and try to or deal with it. I'm just amazed, actually. So my question is, do you think that teachers really hold this information, or that they do go to the sources that need
Sure.
to be
And like most of you, I've spent a lot of time in all kinds of classrooms at every level. And many students ask questions. They come to us as educators or coaches or adults or whatever with certain questions. I think most questions they come to us with are fairly, relatively routine about curriculum or some things that aren't necessarily directly school related, but I hear again and again today sexuality type questions, which I never, honestly, with all the time I spent in classrooms, I never got that type of question. The concern is that our culture is getting to a place where there is more and more talk and discussion of sexuality, transgenderism, that is not necessarily the purview for a teacher or a professor. And if we're creating, again, that cultural expectation that now, in ways that we never used to, we used to be a clergy person more so than today, a teacher being the default person to go to when you have questions of your sexuality, that is the difference. I think a lot of the routine stuff, to your point, of course, we all did that, but when you get into serious psychological issues, to have students more and more today get the message that, okay, I'm not sure what my sexuality is, I'm going to talk to my teacher. I think that cultural expectation is one we need to be very careful of. And again, I think this bill helps to shine a light on that and to counter that.
Representative Woodcock.
Thank you. Representative Moffett, welcome. I just want to follow up and I understand your concern about the putting the teacher as the second in command here, or the parent. But if a student comes to a teacher with a question because they can't go to the parent, or they don't want to go to the parent, now we take that teacher out of the mix. Where does that youngster go? Does he go to another 14-year-old and say, what do you think?
Sure, and that your point goes to my point, is that there's kind of an inherent implicit assumption here that the teacher needs to be on call to be a trusted adult. And that happens, and in some cases it should happen, does happen. But my concern, which others share, is, as I've said before, the assumption that seems to be more prevalent that the teacher needs to be that the first option, go-to default person to go to when you have a question on something personal. So I think that culturally, if we can not put teachers in that position of being the default trusted adult, I think we're healthier if we have others in the mix too, perhaps, as opposed to having the teacher the default.
Just a follow-up.
Oh,
But I understand what you said, but didn't get to my answer, my question. My question was, if I can't go to a faculty member, I'm not going to my parents, I have to go to somebody. So who are you recommending they go to? They're going to someone they think they can talk with.
Right.
All right. And if it's something of crisis nature, we've been trained, all of us have been in the classroom as well as you. This is where you have to go with that question. But the bulk of the stuff that comes, if you're saying, if they know they can't come there anymore, you left that youngster out on a limb. He's not going to go to the priest. He's not going to go to the Baptist minister. He's not going to go down to the Cornerstone and talk to that guy, that's for sure. So I don't know where he's going to go. But he's not going to come to anyone. Now, we left the youngster out there without any help.
Sure, he or she.
I don't know.
That was the question.
Yeah, right. I don't know. We need to criticize previous.
Well, it's not who we might not go to. That's all. As an example.
Okay.
Well,
I think it was out of bounds.
I apologize, Mr. Chair. I should have said that. I wouldn't go there.
I think I'm tracking you, and I'm not saying that students should not go to teachers. I think the point of this legislation, proposed legislation, is that if a student does go to a teacher, and many do, and many should, because as we all know, there are cases where students have relationships with teachers, and there is that trust level. The concern is that, there's a highly publicized case a year ago where a teacher took a student for a medical procedure that got a lot of attention, and was that the right thing to do? Right. So I think that type of thing that happens, not that often, but it does happen. I think that helped to prompt this type of thing. So to your point of your question, I think students should be comfortable talking to their teachers, and it's case by case basis and common sense and ethical type questions that on an individual basis the teachers need to work through. And I'm not saying that I would oppose students trusting and confiding with teachers. There are certain areas, though, that parents should not be cut out of the loop. And that's a tricky thing, and you can't put words in statute to cover those scenarios. A lot of it depends on common sense. I think the point of this legislation is to underscore the importance of not cutting parents out of the process, and also, again, shining a light on whether teachers should be assumed to be the default, number one, go-to persons when students need a trusted adult.
Thank you, Mr. Chair.
Representative Murray.
Thank you. Representative, I hear you on asking teachers to do more. That conversation that you feel like the burden, there's a lot being asked of teachers today. I don't disagree with that statement. That being said, if something is disclosed or divulged, whether it's verbally or in writing, about a myriad of different circumstances, wouldn't you think instead of the burden being on the teacher would probably turn to either a school guidance counselor, school social worker, or the school administrator first for guidance?
Sure, and I have to think.
I'm sorry. Rather than, like I think Representative Hall said, harboring that and holding that and owning that for themselves to be the.
Sure, I hear you, and I think that happens all the time. I think in most cases in most schools where students and teachers have various degrees of relationships, that 99.9% of the cases, the teachers are professionals and good people, and they have the best interests of everybody at heart. And they know, especially experienced teachers, they know who to go to, who to refer the student to. Did you talk to this person about that? Did you talk to a counselor? I think in that tiny fraction of cases, like I just alluded to, and I saw some of you shaking your heads, where a teacher would get involved with a tremendously significant personal, psychological, physical, medical situation that puts the school at risk, liability-wise, and the teacher ethically, and also could create problems between the student and their parent. To have a measure like this in statute that underscores the importance of disclosure. And I know, yes, I know there are cases where students are not safe talking to their parents. And in those very rare occasions, I have to trust that the teachers will figure out a way to do the best thing so that eventually, whether it's circuitously or not, the parents are not out of the loop completely. That's a concern of me and many others.
Further questions? Thank you very much.
Thank you, Mr. Chair.
Representative. And Representative Selleck.
Thank you, Mr. Chair and Education Policy and Administration Committee. For the record, my name is Lauren Selig, and I represent Durham, which is Stratford County District 10. Take my glasses off so I can read. So prior to my becoming a state representative, one of the many jobs I had was as a middle school and high school English teacher in Maryland. I've been out of the classroom a while now. Some of my students have turned 40, a couple of them more than that. It's a little strange. But they're still in touch with me, several of them, for advice and guidance about various issues. And I'm glad that we have the kind of relationship where they feel this many years later that they can still reach out and have that relationship with me. When I was a teacher, I worked hard to foster relationships with my students so they would feel safe and comfortable talking with me about their problems. And just to give you an example of how safe and comfortable, if we go back to 9/11, where I was a teacher in Maryland and many of my students worked for agencies that no one knew existed, at 10:30 p.m. that night, my home phone rang. The call went kind of like this. Miss Weiss, yes? You have so-and-so in your class? Yes, who's this? You're not going to ask any questions. That's our job? Okay. So-and-so is going to come talk to you about a situation tomorrow. You're not to disclose that to anyone. We've identified you. We've done a full background check. We know that you're a safe space for her to come speak. But please know that what she talks with you about in the classroom when she comes to speak to you is between the two of you. Click. So my student's dad worked for one of those agencies, and while technically no planes were flying, he was already deployed. I was her one person she was allowed to talk to outside of her home, total, because of the relationship she built with me and felt safe and comfortable talking to me. Right, and obviously I'm not sharing anything that at this stage of the game puts our country at risk or anyone else, but that was the level of relationship I built with my students, that they would feel safe and know they had a safe space. My students talked with me about all kinds of problems. Sometimes they talked about the fact that they were in a dating relationship and they wanted to break up with someone without hurting their feelings and needed a way to do it. Sometimes they wanted to come talk to me because they were questioning their gender identity or their sexual orientation, and they wanted to talk to their parents and were terrified about how to do it. And they wanted to practice the conversation so that when they went to talk to their parents, they would know how to react depending on how their parents would react. Sometimes they'd say, can you be my dad and be really angry? Can you be my mom and yell at me? Can you be, so that they could practice what they were going to do and anticipate what to do when they got to that conversation and when they were ready to have those conversations. Not when I was ready, not when their parents asked. I'm also the parent of 2 teenagers. And from when they were very little, we worked hard to make sure they had relationships with other adults in their lives. I can't tell you how many bonus moms they have, but I will tell you that both of my kids have a lot of adults in their cell phones at this stage that they know they can reach out to for help and guidance when they don't feel comfortable talking to my husband and me. And my kids talk to me about everything. And let me tell you, there are times I wish they didn't, but they tell me about everything and they feel comfortable and safe because I've worked hard as their parent to build that relationship. It seems to me that this bill and other legislation like this are bills saying that parents have forgotten that they are the ones responsible for building the relationships with their children. It's not the teacher's responsibility to fix the relationship between the parents and children. That's the parents' job. The number one rule of parenting is love your child. Period. That's actually where the job ends. There's lots of things we need to teach our children, but our number one responsibility and our sole responsibility is to love our children no matter what. Unfortunately, we have a lot of parents in our society who forgot that, and kids sometimes think that their parents forgot that and reach out to teachers for guidance and adult because they build that safe space. Bills like this circumvent that. They take away safe spaces for our children. They take away safe spaces for our students. They are likely to increase, and we know historically in states where these kinds of things have happened, it does increase the suicide rate among teens. We want to prevent suicide. If a student comes to me and tells me that they are planning some kind of self-harm or committing self-harm, as a teacher, I am obligated obligated to make note of that and to make sure people know to protect that child's well-being. And even now that I've been out of the classroom for more than 20 years, I am still obligated if a young person comes to me and tells me that they are planning to commit suicide or some other form of self-harm, or if they're planning to commit some kind of danger to others. I am obligated to report that, as I would hope all of us would be. We need to oppose bills like this because bills like this are harmful to children. They do not benefit our children. They don't build better relationships between parents and children. They only serve to sever those relationships and present it as though teachers are not to be trusted. We entrust our children to our schools and to our teachers because teachers are trustworthy. They're trustworthy and deserving of our respect and gratitude for that. But I also want to close with a story from 7 years ago in the community, in my community. We had a young man who was raised in a very, very tight-knit religious family. He tried to come out to his family. He was told he was wrong, that he was not gay. He was told he was broken, that he was terrible, and various other things. He tried again to talk to his parents. His parents again proceeded to tell him what a terrible idea it was that he be gay and talked about all the ways they could cure him of his gayness. So, because he knew who he was, and because he knew that he would never be able to get his parents to love him for who he was, he took his parents' minivan and he got on I-95 and he put his car to the maximum speed that he could and drove it straight into the barrier at the toll plaza. Now, if he had been able to have a family that would have been able to love and support him for who he was, that young man would be here right now. He'd be a college graduate and he would be going on to live a full and happy life. But unfortunately, not every kid has parents who love and accept their children for who they are. If a child feels concerned that they cannot talk to their parents, we need to make sure that they have spaces that they can talk to people. They may not have a priest or I don't know, you gave a lot of religious leader people that they talk to. They might not even have a neighbor they feel safe talking to. But if they feel safe talking to a teacher and that's their person, we need to respect and honor that relationship so that we can help that child grow and flourish into a strong, healthy adult. For that reason, I strongly oppose this bill and I really hope that we can kill it.
Any further questions? Seeing none, thank you very much. And with that, we'll close the testimony on Senate Bill 96. And just one point before we break for the day. Naturally, Gen 4 is out ahead of us and has gotten information from HB2, and I'll just read it to you in relation to the Medicaid to Schools program. The program shall terminate statewide if the federal government or state adopts any policy contrary to a policy requiring parental control of all medical services provided to children. If a local school district adopts such a contrary policy, the program shall terminate for that school only. So that's what's in HB2. Thank you, Jen. Further? That's correct.
Excuse me, emailing that?
Sure, yep. Right, and as Jez said, this is in the majority amendment to HB2. So with that, we'll see you.
Amendment to HB2?
There's many amendments to HB2.
I know.
Yes. We'll see you on the
Majority amendment from finance.
right 23rd. Tomorrow, yes, but the committee will see you next on the 23rd.